Representative Duran.
Madam Speaker Pro Tem, I move for a call of the House.
A call of the House has been requested. We need 10 or more people to stand or raise your hands. All right, there's 10 of you. The motion is properly sustained. Will the sergeants please close and lock the doors? Mr. Gregorio, turn on the chimes. Members, push your buttons to indicate your presence. And Mr. Gregorio, please call the names of those who are absent. And will the sergeants please locate the members who are missing?
Representative Amabile, Bacon, Burnett, Byrd, Basenecker, Carver, Catlin, Escar, Exum, Froelich, Geithner, Gonzalez Gutierrez, Gray, Herod, Hooten, Jackson, right there. Judah, Kip, Lynch, McCluskey, McKean, Sandridge, Sirota, Valdez D, Van Winkle, Weissman, and Young.
She's talking to you. Push your button. Oh.
Is the motion any different, or is it the same motion? I think it's just continuation of set. Okay.
How was it? Yes, it's on my desk. Push your button.
Exum is excused. He's going to be back on later, but he's...
Where's Julie?
Right now. Thank you.
Yeah, I just have to do one thing. You ready?
Geithner, Gonzalez Gutierrez,
Push your button.
Hooten, Judah,
Push your button. Push your button. Push the button.
McKean, Van Winkle, and Weissman.
Representative Duran.
Thank you, Madam Speaker Pro Tem. I move that the call be raised.
It's been moved that the call be raised. All those in favor say aye. All opposed, no. The ayes have it. The call is raised.
Next order of business is continuation of second general order, second reading of bill.
Our next order of business is continuation of general order, second reading of bills. Representative Gray. You've heard the motion. The House will resolve itself into committee of the whole, and Representative Gray will take the chair. And
The committee will come back to order. Just as a reminder, with your unanimous consent, the bills will be read by title unless there's a request for a reading bill at length. Committee reports are printed and in your bill folders. Floor amendments will be shown on the screen and on your iPads. Bills will be laid over upon motion of the majority leader, and the coat rule is once again relaxed. Mr. Gregorio, please read the title of House Bill 1232.
House Bill 1232 by Representatives Roberts and Judah, also Senator Donovan, concerning the establishment of a standardized health benefit plan to be offered in Colorado.
Thank you very much, Mr. Gregorio. For those of you paying attention at home, we previously approved the Appropriations Committee report, so that is still approved as we sat but beg leave to meet again. We are to the Health and Insurance report. And I don't know if there's any discussion or, Representative, it's McKean, isn't it? Yes. Mr. Minority Leader.
Thank you very much, Mr. Chair. It is an honor to work with you.
It is an honor to serve with you, sir.
Pardon me for 1 second while I take care of some housekeeping. Thank you, Mr. Chair. Folks, we're about to get into a long discussion, and it's going to be a long discussion. But it's going to be a discussion that we have because it's so extremely important to the state of Colorado. I was kind of joking a little bit in committee. I try to bring a little levity to things, and I mentioned that this is when I have concerns about a bill. It's when my bill folder gets to be over an inch in thickness because of the notes and the research and the things that are in it. One of the things I think we start with tonight are the places where we come together. You heard this morning, you have heard a few times when this bill is concerned that we want certain things. We want to maintain or increase the quality of care for medical care in this state. We actually had a doctor who came to committee, and that doctor said one of the better things that I've ever heard. He said, in America, we expect a lot out of our medical system. In fact, we expect the best. When we talk about going somewhere else for medical care, it's never to get better care. It's sometimes to make it fit into a schedule or get reduced cost. It's never to get better care. We know that the best care you can get in the world is here, in the United States of America. That is a remarkable testament to who we are and how our medical system rewards innovation how our medical system rewards the kind of care that our people want, our families want. And it's the reason why people come here when something seriously goes wrong. The other thing that we hear in all terms is that we would very much like to see the costs go down. So I'm a contractor. Most of you know that. Most of you don't know that that means I kind of do everything. It means that I do plumbing, I do electrical, I build buildings. Occasionally I tile them. Occasionally I grout them after I tile them. That's just to say that's what I've been doing the last few weekends. But the challenge that I have in that business is finding the way to make sure that I can reduce the cost for my clients so that I can be the attractive contractor to hire. I'm going to show up on time. I'm going to do the best job you've ever seen, but I want to make sure that every time I can give somebody a bid, I can show them that they actually save with the quality they want. They can save some money. So we want that. But it doesn't always work. And I will tell you the truth that there are towns where I can't go do all the electrical or do all the plumbing. And that means that there are inherent costs built into that. And so when I pull on the string of one, it often tugs the string of another. That is what we see in this bill here today. The challenge that we have is that when we have a bill that has 45 amendments, when we have a bill that could potentially absorb another 50 or so amendments, because there are so many little things that we need to fix, it means that it's a complicated problem. And so I will take a second to tell the sponsors of this bill how absolutely remarkable I think it is what you have engaged upon. I think that you have done an amazing amount of work. Representative Roberts, I see your heart in this bill. I actually saw your heart tremendously in the first draft of this bill of what you would like to accomplish. We will be at odds about how to go about accomplishing that, and that's okay. But I think this is a complicated problem, and I think that the amount of your stakeholding on this bill has been yeoman's work. It has been incredibly difficult, and I thank you for doing it. I thank you for every single case you've heard about why this isn't working or that isn't working. And I'm going to offer some amendments tonight. I'm going to ask you some questions, and I want to engage, because here we are in the Committee of the Whole. We finally have an opportunity to kind of talk amongst each other and answer a few more questions and really not berate each other, but just explore. So thank you for that. Thank you for the work that you've done. With that, I posit that this complicated problem is probably too complicated for government. And that, I think, is important to sort of absorb. Because when we get this complicated of a problem, we have so many interested stakeholders, so many people pushing and pulling at the edges of this, that if you move one thread, it moves the center of agreement out from the center. And now you have to find out if all of the other parties can come to that. And that's how difficult this is. And it is with a tremendous amount of humility that I understand that. And I understand that where we are today is not where everybody wants to be. I made a promise to the Speaker of the House and actually to Representative Roberts that if we could get this bill to a place where everybody says, you know what, it might not be perfect, I might not like it, but I can live with it, I would ask my caucus to sit down and to say, you know what, we don't necessarily agree with it, but so much work went into getting it to that point that we can be comfortable saying we're going to vote no, but we're not going to just go no way. And so we sit here today without that. But I want you to know that that's my heart, is that if we can get things to a place where it works, then that's good for all of us. More importantly, it's good for all the people where we come from. So my questions. Number one, I appreciate the idea of a thoughtful pause. I appreciate the idea of taking a minute to take a look at this bill and what it does and how it can do it. I want to start with some kind of surface level things, because in your presentation you mentioned that the individual market in this state is around 8%. The small group market is around 7%. What are the other groups that are mandated care in this state? And what size are those markets? It matters because I want to get to a place where we're talking about how many lives does this affect? And I know that that's a healthcare term. How many lives do you cover? But I understand that it's around 50% of the healthcare market in Colorado that's under Medicare or Medicaid, and that this is an additional 15%. And you can nod, and I think that's correct, or marginally correct. So folks, that's around 65% of the healthcare market in this state that has mandated coverage to this extent. And so to the sponsors, I would ask, number one, have we seen programs in the past that have worked to drive down cost? And if so, what are they, and are they still in place?
Further discussion on the Health and Insurance Committee report.
Specifically reinsurance. Is it still in place? Is it
Representative Roberts.
Thank you, Mr. Chair. Thank you, Mr. Minority Leader. So I was just asking for some clarity. The Minority Leader said he was speaking about reinsurance. And I know there's some experts on reinsurance in the chamber who might want to talk about this as well. Reinsurance is in place. It was passed first by this chamber in 2019 and then re-upped last year with Senate Bill 215. You asked, though, specifically, Mr. Minority Leader, is that a program that drives down costs? No, reinsurance does not drive down costs. Reinsurance makes it cheaper for people to buy health insurance, but it does nothing about the underlying cost of health care. Unless we get at the underlying cost of health care, even in a very small way with this bill, we will have to continue to subsidize high insurance prices. That's what reinsurance does. I'm a fan of reinsurance. I supported it, co-sponsored it, and thank Representative McCluskey and Kennedy for their work on that. But it doesn't get at the underlying cost. It helps people buy insurance, but it does nothing to make that insurance less expensive or the reasons why that insurance costs what it does.
Mr. Minority Leader.
Thank you very much, Mr. Chair. And a little bit, well, we don't have to dialogue, but just a couple more questions. Because I think what I want to do is partly flesh out what's not in the bill, but makes up what the bill is important for. So what are those costs? What are the elements of the cost structure that really we're trying to get to the heart of to create reductions so that healthcare can cost less for Coloradans?
Representative Roberts.
Thank you, Mr. Chair. I would love to get at the high cost of healthcare in Colorado. That's a really big category. This bill is not about fixing all of the ails in healthcare in Colorado. This is about creating one new individual market or small group market insurance product by trying to look holistically at some of the reasons why those two markets on the individual market and the small group market are more expensive than others. But if you want to have a conversation about the whole overall cost of healthcare, that's going to take multiple bills and probably multiple years. And I look forward to working on those bills with you, Mr. Minority Leader.
Mr. Minority Leader.
Thank you. And truly, I look forward to that too. I really do, because I think, we've heard then Representative Rankin, now Senator Rankin, talk about the total cost of care, where really you encapsulate the cost of healthcare providers, our doctors, where you encapsulate the cost of hospital care, of outpatient care, of all of these elements. And that's what I want to drive at, is that again, when we talk about what this programmatic attempt at a solution looks like, we are really talking, in this instance, about three drivers. You have doctors, you have hospitals that are mentioned in this bill, and you have insurance plans. Those three drivers. But there are elements of this that are left out. And so the caution that I'm getting at through some of our questions in the dialogue, and thank you for the debate, by the way, because it's a rare thing here, and it is a wonderful thing, because this is a committee hearing. And so it's really wonderful to have that ability to back and forth. One of those big drivers is pharmaceuticals. Pharmaceutical costs we know they're high. We know that they're a pretty big driver of healthcare cost. was there a consideration to put pharmaceutical cost into this bill so that it covered sort of the greater panoply?
Representative Roberts.
Thank you, Mr. Chair. I agree, and thank you for acknowledging that pharmaceutical costs are way too high, Representative McKean, and there are several pieces of legislation that I would encourage you and your caucus to consider as they come through this chamber on that point this year. Pharmaceutical costs are not high just in the individual market, though. And so we should address them more holistically than just one insurance plan. That's why they weren't included in this bill, is because, again, we're trying to get at a very specific problem, not trying to cure all of the ails with healthcare. But that is certainly not to say that I do agree with you that pharmaceutical costs are way too high, and I would appreciate your support on that legislation as well.
Mr. Minority Leader.
Thank you. And Representative Roberts, thank you. I tend to try to, I do remember Representative Arndt when she was here, she said, no, those weren't my words. And I didn't say they were way too high. I said they're very high, and sometimes they're high for all the right reasons, right? Because we live in a world in the United States of America where we expect the best drugs to do the best job, which cost a lot of money. We don't always necessarily agree on what a lot of money is. But I think that the concern, and again, you're going to hear that a lot from me, the concern that I have is that when we look at trying to solve these two markets, the individual and the small group market. Small groups are up to 99 individuals, as I understand it. And so when we look at trying to solve this equation, but we don't include something like pharmaceutical cost, it seems that what we're really creating is a place where we have shifted the cost of what it is that we're trying to do onto the backs of other elements. And in fact, it's why I brought up reinsurance, because we know that what we saw in that, as we tried to create a systematic way of helping drive down costs, especially in the high country, what we really did was we said, well, this is going to be a government-backed program of not paying the claims, but reinsuring, guaranteeing the claims. And we had a reasonably small fiscal note, and my then neighbor said, gosh, this is a good idea, and I said, I'll give it a shot. And then it came back with a fiscal note that was multiples times higher because what it did was it cost more to do because we hadn't thought about all the elements. And so when we get down to a program like this, I certainly don't ever want to get to that place where we are worried about what unintended consequence we end up with. And so on the pharmaceutical side, I think it's an important consideration. It's not here. And therefore, if the pharmaceutical costs are high, and if those go into some of the cost elsewhere in this process, then what we're really doing is just shifting costs from one place to another. And that was why I asked you those questions in committee about cost shifting. And so in this plan, and certainly about the kinds of cost shifting that we see, and in fact, I guess what I would like to start with is, what is your understanding of cost shifting? And how does this bill prevent it?
Further discussion on the Health and Insurance Committee report to House Bill 1232. Representative Roberts.
Thank you. I feel like I'm getting quizzed here by law school professor or something. Thank you, Mr. Minority Leader. So page 15, lines 13 through 26, protect against cost shift by any cost shift that may happen. We don't think it will, but in case it does, we put it in the bill. Page 15, lines 13 through 26.
Further discussion on the committee report, Mr. Minority Leader.
Well, thank you. And I like having it pointed out, and it's not a quiz. It's an understanding of where we'd be. So we have page 15, and we have lines what?
13 through 26.
Well, there we go, 13. So what it really says is there won't be cost shifting. How do we guarantee that?
That's not what it says.
Okay, so what it says is, if the administrator of a self-funded health insurance plan voluntarily provides to the commissioner its contracted rates and any other information deemed necessary and agreed upon by the administrator and the commissioner may evaluate whether the rates of the self-funded health insurance plan reflect a cost shift between the self-funded plan and the standardized plan offered by a carrier. Now, the reason why I think it's important to say it says that they won't be there is that it's saying the commissioner can determine if there is a cost shift. Why is that important? Why is it important that the commissioner determine if there is a cost shift?
Further discussion on the committee report. Seriously, though, further discussion on the committee report.
There is further discussion.
House
I'll
Bill-
tell you why it's important.
Mr. Minority Leader.
And I won't say that the words are coming from my colleague. The reason why it's important is that if what we are trying to accomplish, the laudable goal of reducing the cost of healthcare for people, is if what we do is say you're mandated to reduce this over here, and yet what you really do is drive up cost over here, you are shifting the cost. You have not saved anybody any money. In fact, you may have put more of a burden on the people who now have higher costs on another part of the market. That is why I think it's important in this that the commissioner examine when they are looking at rates to figure out whether or not that's true. And this is under self-funded health plans. So we're talking about a big problem, and that's truly what the discussion is. And yes, I will just talk to you, but this is kind of just talking in terms of why it's important to have the discussion about what's in this bill, because it is far different than it was early. It's far different in all of these iterations. And I was actually saying this earlier to Representative Weissman, and I think it's important to say right now that, of all the times in this chamber when I have thought that it was important to hear a bill, it was when we had the turducken bill. When it was 3 bills crammed into one at the very end of the session, I didn't know it was in there. And I think that's partly the case here now. It's not that we don't all know, but it's that we all need that information to make a good decision. So it's with that temerity that I'm having a conversation with you. I appreciate it more than you know, because I think that it's important, and I think that it's important to dig in. So I appreciate that, and you referred me to where that is in the bill. If there is cost shifting, meaning savings in one place and higher costs in another, does this bill protect the healthcare consumer?
Any further discussion on the committee report to House Bill 1232? Representative Roberts.
Thank you, Mr. Chair. I mean, what do you mean by healthcare consumer? Do you mean by the healthcare consumer that has decided to purchase the Colorado option? You mean somebody who's a small group market customer, a large group market customer? What do you mean by healthcare consumer?
Thank you. I really
Mr. Minority Leader McKean.
Thank you. I really mean the patient that is now covered under this plan, an individual market consumer, a small group market consumer, the patient. Because truly what we're saying now is there's a mandate decrease in rates, right? So there's a mandated, this is what we want to see as far as a decrease in rates. And then we've also seen that there are an establishment of different reimbursements for doctors and other groups and for hospitals. So if that's the case, if what we're trying to do is drive down costs by government saying you will drive this down, then often we see where it is defined in this bill, the cost is driven down, but then you will see that there's a growth in the cost somewhere else. And when we talk about cost shifting, this is very important, because this we see a lot of. And the concern, I guess, is that if we have that, if this bill protects that patient, I just want to know that it's robust, that it protects patients from cost shifting because of the mandated decrease.
Further discussion on the committee report, Representative Roberts.
Thank you, Mr. Chair. Okay, now I further understand. I mean, Mr. Minority Leader, you're assuming that this is all a zero-sum game, that there is no way that we could ever cut any costs in healthcare, that if you cut costs here, then that means costs need to be raised somewhere else. We all know, and everybody, including this side in their introductory remarks this morning, said that healthcare costs are too high. There is immense profit in healthcare. We are asking and giving the voluntary opportunity, giving them a target they need to meet, and then they get to decide how to meet those targets. Modest 6% a year for 3 years, and then they get to account for medical inflation, so it's not even going to be anywhere close to 6%. They get to figure out how they would like to reduce their costs on their own. We protect the consumer in here because it's a standardized plan that will cover essential health benefits, that will cover preventative care, and make sure that people are insured. But assuming that this is a zero-sum game, and that there's no way to achieve savings at all for Coloradans, I think is a false premise.
Mr. Minority Leader.
Thank you, sir. I don't think that's my premise. I don't think it's my premise to say that costs are too high. I think that the challenge is always, and for families, especially families who are just trying to plan, then what the laudable goal here is to say that what we'd like to do is make that an easier task. You have raised a few issues about constituents in your district who pay exorbitant amounts for health insurance. And yet in committee, I asked you if there were plans available. And I think there's a discrepancy, maybe even in understanding, because I've asked that question again outside of the committee hearing, and I've heard that there are, and that there are plans and that there are the availability of programs that help families who are paying a lot in health care. And in fact, the challenge that I think we have is that we have to make a decision of what's best for the whole state, not just your district. And you understand that, I know. I'm not suggesting you don't. What I'm saying is that it seems to me that when we come to this bill and when we come to reforming, even if it's just 15% of the market, we are making changes that will affect the state as a whole. And when we do that, I think that we have a huge task ahead of us. Because what we're really saying is this then answering maybe a question where people don't know some of the things that they can have available to them? Maybe it is a circumstance where there's one or two people who say, you know what, this just isn't right. But then does it affect that market as a whole? That's why I'm focused on sort of the larger macro pieces of this. The ideas of cost shifting, the ideas of what is not included in this bill. And partly because this is, I think, our job here, is to begin that discussion, begin that conversation so that as we try to bring in the elements that we think will help with that we agree that those elements are problematic, that they are necessary pieces of the puzzle. So with that, I would like to suggest that we have a little bit of a chance to talk about who is still sort of on board, who are the latecomers to a position on this bill. I know that there have been some changes just since this morning, and if I could have the sponsors just let us know kind of where we are as far as maybe some of the people who we've all been talking to, all the stakeholders, so that I kind of understand what that comfort level is of what is it. Do we have, I know you mentioned Children's Hospital with an amendment would come on board either on a neutral or support position. Do we have others who have come to a position since this morning so that we get some updated information?
Any further discussion on the committee report to House Bill 1232? Is there any further discussion? Representative Rich.
I need to know that so we kind of have that conversation. Okay.
Representative Rich.
Yep.
Thank you, Mr. Chair. We're probably in for a long night. I have probably been involved in healthcare more in the last few months than I've ever wanted to be. But I want to tell you some things that I have learned because those were brought up today. 77% of our voters with health care insurance coverage are satisfied with their coverage. 73% of voters are unwilling to pay any more for health care, and 71% are unwilling to pay any more in taxes to create a public option. Most voters are concerned about the impact of the public option on access to quality care. That's 77%. And payroll taxes, 73% they're concerned about, and closures of at-risk hospitals, that's 72%. I have several pieces of paper here because several doctors have been in contact with me today, and I hope they're watching tonight because I advertised a lot in Western Colorado what we were going to be doing here this evening. One of the doctors wrote to me, and I want to share this with you, and then I have something else to say. Dear Representative Rich, I am a physician practicing in Colorado, and I am writing to request that you please vote no on House Bill 21-1232 on the House floor. As a physician frequently caring for patients burdened by the high cost of health care, I agree that costs must be reduced. However, this bill will undoubtedly do harm to patients and the health care system. This bill is an unprecedented, illegal step too far. No commercial, state, or federal health benefit plan requires mandatory participation.
Representative Rich, can I interrupt you for just a second, folks? If you need to talk about something right now, can you please, again, there are doors there and there and there, can you please take a conversation off the floor and direct your attention to the well? Thank you.
Thank you, Mr. Chair. Coercion of burned out and demoralized physicians who have been on the front lines of a pandemic over a year will not make a healthcare system that is sustainable. Passing a bill like this will grant health plans all the power at the expense of community physicians and the patients we serve. The bill provides even more leverage to highly profitable health plans to only offer take it or leave it contracts to physicians. Under this bill, corporate executives and shareholders will continue to profit at the expense of physicians and patients. As written, this bill only focuses on slashing costs. It will erase any incentive to providing high-value, innovative care. It will exacerbate already significant healthcare workforce shortages, especially in rural and underserved communities. Mandatory participation in the public option will drive physicians away and make the task of recruiting and retaining physicians even more difficult. Thank you for voting no on House Bill 21-1232. This was written by Angela Pinnell, MD. She is a pediatric anesthesiologist. She is president of the Anesthesia Consultants of Western Colorado. I also received a call from a doctor yesterday. He grew up in Grand Junction. He went to high school in Grand Junction. Then he had to move away to go to college and go to medical school. He told me it took him 16 years to get back to Grand Junction to practice medicine. And it was heartbreaking for him that if a bill like this passed, he was going to have to move his family out of the state of Colorado. Now, earlier today, we talked about stakeholders and how many people have been at the table and either came to a neutral position or, but I want to tell you, as of this morning, who still opposes this bill. The Adams County Regional Economic Partnership, the Ambulatory Surgery Center Association, America's Health Insurance Plans, Americans for Prosperity, Anthem, Associated Governments of Northwest Colorado, Aurora Chamber of Commerce, Centennial Institute at CCU, Cigna, Colorado Concern, Colorado Radiological Society, Colorado Society of Anesthesiologists, Colorado Society of Physicians and Surgeons, Colorado Ambulatory Surgery Center Association, Colorado Association of Medical Equipment Services, Colorado Bankers Association, Colorado Business Roundtable, Colorado Chamber of Commerce, Colorado Competitive Council, Colorado Contractors Association, the Colorado Medical Society, Colorado Obstetrical and, boy, that's easy for me to say, and Gynecological Society, Colorado Psychiatric Society, Colorado Radiological Society, Colorado Retail Council, Colorado Rural Health Center, Colorado State Association of Health Underwriters, Colorado Society of Anesthesiologists, Colorado Society of Eye Physicians and Surgeons, Colorado Springs Chamber and EDC, Colorado State Association of Health Underwriters, Colorado Women's Alliance, Colorado Health Plans, CVS Health, Denver Metro Chamber of Commerce, Denver South Economic Development Partnership, Douglas County Business Alliance, the Fruita Chamber of Commerce in Western Colorado, Family Health West in Western Colorado, the Grand Junction Chamber of Commerce, HCA Healthcare/Health One, the Hispanic Contractors of Colorado, Jefferson County EDC, Kaiser Permanente, the Liberate Initiative, Lockton Companies, Longmont Chamber, Mednex, Mesa County Physicians, Mountain West Dermatology, which is also in Western Colorado, Northern Colorado Legislative Alliance, Optum, Pacific Dental Services, Panorama, Pro 15, Rocky Mountain Mechanical Contractors Association, Denver Pipe Fitters Local 208, South Metro Denver Chamber, the Square State Strategy Group, United Health Group, U.S. Anesthesia Partners of Colorado, and the Valley Partnership. Now, when you still have that many that oppose this bill, maybe there needs to be a little bit more stakeholdering. There's probably more that I'll say before this evening, but I'll stop right there. There's no way I can support this bill. I've heard from too many people from rural Colorado that oppose this bill.
Thank you. Representative McCluskey.
Thank you, Mr. Chair. And I wanted just to speak to a couple of points that I've heard here in the well tonight. One, how does this plan serve the state, the entire state, not just the Western Slope or the districts where we see some of these incredibly high costs? It serves the entire state because every additional life that we get covered with health insurance means one more opportunity to make sure that we aren't putting uninsured costs into that cost-shifting bucket. The more lives insured, the more people that are paying into the pot and receiving coverage, the more people that are paying into our providers' pockets, our hospitals, our doctors, so they're not having to pass along those costs to others. I know it was hard for me to grasp that initially, particularly on a statewide perspective, until I realized that my Centura Hospital in Summit County was cost shifting to help cover expenses down in Pueblo. You know, that's how it worked. Ski season is a very profitable time for our hospital, and I'm a big fan of Summit County, our hospital up there, St. Anthony's, Summit County. And I understood then how the system is working. It happens everywhere, and it happens on the Western Slope and elsewhere in the state. So again, the more lives that are covered, the better all of us are in Colorado. And you're right, I do hear concerns from many of the providers, the carriers, those that are on one side of the healthcare system. But I also hear a lot of concern from the working people and families in my district. I'm sure many of you have heard those voices too. They don't have an association that's down here in the lobby today talking on their behalf. They have us. And they have communicated over and over again, we're looking for an option, a way that we can afford health care coverage for our family. Now, reinsurance helped bring down the prices of those plans on the marketplace, helped bring those down. That was a great first step, but reinsurance was never designed to be that midterm or long-term solution for Coloradans. We started the work. We voted on the study for a Colorado option. That plan is now before you today. Yes, it's gone through some iterations, and it's gone through some iterations because this is an incredibly complex challenge, and it deserves a complex solution. We need to meet it. We need to meet the challenge of coverage and access head on. I am grateful to the concerns to my colleagues who have presented concerns, because I think that's an important part of this process, that we're listening to each other. And I hope that you've listened to me. So thank you.
Further discussion on the committee report. Representative Pico.
Thank you, Mr. Chair. We've heard a lot about cost shifting and what is driving the high costs of insurance. And there are several aspects I'd like to touch on. The mandates that the insurance companies have to cover various and sundry procedures have to be picked up and covered, and that is one of the things that drives costs. If you mandate a certain thing, everybody has to pay for that through the insurance rates. And let's be clear that these are not insurance. Insurance is risk spreading of different risks that come up there, and you're going to pay something based on the the average cost of picking that up. But if you come down there and your odds of having an office visit are 100%, that's not insurance, that's a medical plan. And the more and more that you mandate certain things to be covered, the more and more that drives the cost up, and the more cost shifting it is to those who would not perhaps use a particular procedure. And so that's one of the problems we have here, is that how many mandates get loaded on there? If you have to have more mandates, that drives up the costs. And to that point, I move Amendment L065 and ask that it be displayed.
Amendment L065 has been moved and is properly displayed, and then it went away again, and now it's focusing. And there we are, and here we are, to Amendment L065.
Thank you, Mr. Chair. What this does is amend the Health Insurance Committee report to not require a carrier to provide coverage for treatment or services for any mandated coverage requirements under Section 1016-104 that take effect on or after January 1st, 2022. And then renumber everything. And that's one of the key things here is let's stop loading on the mandates. You make sure that you put something that's predictable, that people can plan for, and by people, the insurance company, providers, and everybody else, and put some sort of cap in place so these kind of costs don't escalate. I ask for an aye vote.
Further discussion on L065. Representative Roberts.
Thank you, Mr. Chair. Members, I ask for a no vote on this. The strike below already includes the ability for the premiums to account for any insurance coverage mandates that get passed by the General Assembly. What this amendment would do is say that insurance companies could literally refuse to cover things like mental health wellness exams. I ask for a no vote.
Representative Pico.
Thank you, Mr. Chair. No, I disagree. This thing says that you're not going to keep loading on new mandates after a set time. It doesn't say anything about denying coverage for any particular coverage, certainly not mental health. It just says, hey, after a certain date, stop loading us up. You're not going to be able to lower costs if you leave it wide open and just add willy-nilly more and more stuff. I ask for an aye vote.
Further discussion on L065. Representative Pelton.
Thank you, Mr. Chair. And I do like this amendment. Seems like almost every committee that the public health holds, there is another bill there to add more mandates. I filled in yesterday on health and insurance, and right now I'm drawing a little bit of a blank, but there was a bill in front of us that passed out of committee to do just this, to add another mandate. The insurance companies have to provide this. And last session we piled on numerous, and it just continues to snowball. And so I like this. Right at the onset, this may look like a good thing if this would get enacted, but years down the road, when we keep passing bills out of this building, it will continue to grow, and we'll have the same problem again without an amendment like this. So I do like this amendment.
Representative Valentine.
Thank you, Mr. Chair. So a specific bill was mentioned that we heard yesterday in committee, and I don't think that we should be debating a bill that's not before us. But I would point out that that bill passed unanimously in the committee, and so if I'm not allowed to say that, then
I was going to say, if everyone in the chamber could stick to this bill and this, in fact, this amendment to this committee report, it would be wonderful.
so then I will withdraw my comments.
Thank you, Representative Montine. Mr. Minority Leader.
Thank you, Mr. Chair. I was sitting there because this was a topic of what is it that we want to institute here where we're not driving up cost. And so I can remember bills that I've voted against that I thought I would love to see that because it was going to drive up cost. Bills that mandated coverage for fertility care. We've had bills that mandate different kinds of care. We've had, I believe the bill that we're hearing discussed was a good idea, right? It was to offer a free mental health checkup once a year. Those are good ideas, but let's not forget that they have a cost. They drive a cost, and that cost is going to be borne somewhere in the system. I urge support of an amendment here that just says we shouldn't do that. If what we're trying to do is drive down cost and create an understandable playing field, then we should not be mandating new coverages after a certain date.
Further discussion on L065. Seeing none, the question before us is the adoption of Amendment L065 to the Health and Insurance Committee report on House Bill 1232. All those in favor, please say aye. Aye. Those opposed, no. No. Amendment L065 is lost. To the committee report, Representative Hanks.
Thank you, Mr. Chair. I'm going to draw heavily through the course of this evening on Dr. Thomas Sowell, and with the kind indulgence of all the members here, I want to start with a piece that he wrote called No Healthcare, and it's during the first 30 years of my life, I had no health insurance. Neither did a lot of other people back in those days. During those 30 years, I had a broken arm, a broken jaw, a badly injured shoulder, and miscellaneous other medical problems. To say that my income was below average during those years would be a euphemism. How did I manage? The same way everybody else managed. I went to doctors and I paid them directly instead of paying indirectly through taxes. This was all before politicians gave us the idea that the things we could not afford individually, we could somehow afford collectively through the magic of government. When my jaw was broken, I was treated in an emergency room and given a bill for $50, which was like a king's ransom to me at the time, 1949. That's kind of remarkable in itself. But I paid it off in installments over a period of months. Like most young people, I was lucky enough not to have any heavy-duty medical expenses that would have required major operations or a long hospital stay. That is still true for most young people today, which is why many people in their 20s do not choose to pay for medical insurance even when they can afford it. They know that in an emergency, they can always go to an emergency room. And today, the idea that you ought to pay for that out of your own pocket is considered almost quaint in some quarters. It is not uncommon, especially in California, with its large illegal immigrant population.
Representative Hanks, to the amendment, please. We are on the committee report. We're on the Health and Insurance Committee report on House Bill 1232.
This is germane, Mr. Chair, in that some of my comments on the committee report were from Thomas Sowell. And they were germane in that here's what he said, and here's what I quoted in that committee report. It'll come from this article that I'm reading right now. And the quote is this: The government does not have some magic wand that can, quote, bring down the cost of health care, unquote. It can buy a smaller quantity or lower quality of medical care, as other countries with government-run medical care do. So that was in the committee, and I read this, Mr. Chair, because it expands on the knowledge of a rather interesting man in our current history. I am surprised that this does not meet your standards of a conversation.
Representative Hanks to the committee report.
I'm going to conclude on this because it is germane. There are, of course, people with huge medical bills that they cannot possibly pay. Believe it or not, that also happened back before the modern welfare state. Some hospitals, whether public or private, could absorb such costs with the help of donors. There were people with polio living in iron lungs, which is why rich and poor alike gave money to the March of Dimes. But that is very different from hospitals being stiffed every day by emergency room users whose only emergency is that they want to keep their money to spend for fun instead of on doctors. The biggest of the big lies in the healthcare hype is that a lack of insurance means a lack of medical care. The second biggest lie is that healthcare and medical care are the same thing. Doctors cannot stop you from ruining your health in 100 different ways, so statistics on everything from infant mortality to AIDS are not proof of need for government to take over medical treatment. Few people show the slightest interest in what has actually happened in countries with government-controlled medical care. We are apparently supposed to follow these countries' examples without asking about the months that people in those countries spend on waiting lists for medical treatments that Americans get just by picking up a phone and making an appointment. It is amazing how many people seem uninterested in such things as why so many doctors in Britain are from third world countries with lower medical standards, or why people from Canada come to the United States for medical treatment they could get cheaper at home. There are a few more paragraphs on this. I appreciate the indulgence. Government price controls on pharmaceutical drugs, which we talked about some moments ago, are more of the same illusion of something for nothing. People who are urging us to follow other countries that control the prices of medications seem uninterested in the fact that those countries depend on the United States to create new drugs after they destroyed incentives to do so in their own country.
Representative Hanks, my understanding is that that's not part of this bill, and that's what the minority leader said earlier. If we could speak to the committee report before us.
Okay, I'll leave it at that, but I will tell you this, Mr. Chair. I want to tell you who I'm going to be talking through, channeling here, and I'll be brief on this. We should all know Dr. Sowell, Thomas Sowell, a little bit better in my estimation. That's an opinion. But let me tell you a bit about him. It's 100 words or less. Thomas Sowell was born in North Carolina in 1930 and reared in Harlem. After dropping out of high school, he was drafted into the military and served in the Marines during the Korean War. During his 20s, when he was a self-described Marxist, he attended and graduated magna cum laude from Harvard with a BA in economics. He also has a master's in economics from Columbia and a PhD in economics from the University of Chicago. He has taught at Howard University, Cornell, Brandeis, Amherst, and UCLA, and is now a Rose and Milton Friedman Senior Fellow on Public Policy at Stanford's Hoover Institution. I've got 29 parts on the medical care, and I hope that we can find some common ground with Dr. Sowell tonight. Thank you.
Thank you, Representative Hanks. To the Health and Insurance Committee report on House Bill 1232, Representative Geithner.
Thank you, Representative Gray. Members, I move L096, and I ask that it be displayed.
Robin. L096 has been moved and is properly displayed to the amendment. Representative Geithner.
Thank you, Representative Gray. And so the purpose of the L096 is to ensure that there is no cost shift between plans and groups, members. And I would encourage a yes vote on L096.
Any further discussion on L096? Representative Roberts.
Thank you, Mr. Chair. I ask for a no vote. The bill already protects against this.
Further discussion on L096. A division has been called. Everyone text everyone you need to text when that happens. Thank you for your patience. The question before us is the adoption of Amendment L096 to the Health Insurance Committee report on House Bill 1232. A division has been requested. All those in the chamber not entitled to vote, please be seated. All those in favor of Amendment L096, please stand and remain standing or raise your hand and keep it raised until the count is taken. You're in favor of the Geithner amendment? Make sure they see you. They won't expect it. It's fine. I don't care. Thank you. You may be seated. All those opposed to Amendment L096, please stand and remain standing in one place until that count is taken. You may be seated. Amendment L096 fails. We are back to the Health and Insurance Committee report. Representative Soper.
Thank you, Mr. Chair, and it's an honor to serve with you.
It is an honor to serve with you.
Members, I rise in opposition to this bill. There's some parts of the bill that certainly I think we could agree on and appreciate. I appreciate where it's coming from, the fact that I think all of us have had constituents who have complained about increasing premiums, certainly in western Colorado where I represent, Delta and Mesa counties. But one thing that is in this bill is the nuance. And the nuance is very important in how we look at that. As many of you know, I serve on the Delta County Memorial Hospital Board, and I'm chair of that board's finance committee. So knowing hospitals' finances is very important. One thing in the strike below that was added in committee, in the Health and Insurance Committee, which is part of this committee report, it talks about the reimbursement rates and what we call plus-ups or enhanced percentages. And there's the base rate, and then on top of that, a hospital can get additional reimbursement rates based on whether they're an essential access hospital or a critical access hospital. I was really curious, if you only look at the rural Colorado hospitals, how many would be considered critical access hospitals versus just acute care hospitals that would not necessarily meet the standard for essential access hospitals? So in mapping those out, it kind of looks like the scatter chart across Colorado. And, a map, I know no one else can probably see it from their seats unless you have really good vision. But I will tell you about it. So first of all, Delta County Memorial Hospital is not a critical access hospital. Neither is Montrose Memorial Hospital, nor is Community Hospital, which is just on the edge of Grand Junction. Neither is Telluride's Medical Center, or up in Steamboat Springs, or down in Durango. However, if you look at what is essential access, so the definition is a hospital that is an essential access hospital that is not part of a health system must receive a 40% point increase in their reimbursement rate. There's only 3 hospitals in rural Colorado that meet this legal definition, because you also have to be under a certain bed count. That'd be Animas Surgical Hospital, because they have 12 beds, which, by the way, for those of you who don't know, that's near Durango, or in Durango. Telluride Regional Medical Center. Telluride, just to refresh everyone's memory, is not exactly a low-rent district. It actually is very expensive, and the people who live there, their average income is almost twice that of my hometown. And then the last hospital I'm sorry, it's Valley View Hospital. Those are the only 3 hospitals out of the list of hospitals in rural Colorado that are not critical access, but they don't meet then this essential access hospital status for this next bump up in payment. I can tell you, out of all these hospitals that were in the red on the map, that are the non-critical access hospitals and don't fall into the 3 that would be part of essential access, the average payer mix is 75% Medicare and Medicaid. What do we know about that? We know that patients that are using these hospitals are not exactly wealthy. Medicare is for the old. Medicaid would be for those who are poor. My home county falls under this. Of the 75%, the vast majority of those are on Medicaid. We were privileged this last summer to have the governor come and visit our hospital, and we gave him a tour to show him some of the COVID protocols. But we talked about these very things, about reimbursement rates. And I can remember the governor said to me, "Why is it that you have so much charity care? Why is it that you have so many people who are cash payers, but they're not able to pay their bills? They get turned over to collections." And part of that is we have very proud people in Western Colorado, and they don't want to be on a government handout. They don't want to be on a plan, which is why I was very appreciative in committee. I asked the sponsors, I said, would you be required to participate? And the answer was no. But that also does not solve the problem, because we still have a healthy number of Coloradans in areas where some of these hospitals are faced with real economic challenges. For example, Delta last year had a negative 4% profit. Negative means you don't make any money. We chose not to fund our employees' retirement. We made a commitment not to lay anyone off. But that commitment, unfortunately, could not be honored. We offer cancer care. And as part of that, we had realized that to ease the pain of some of these treatments, that massage therapy has been proven to help. But when you ask us to make cuts as a hospital, we're not going to cut doctors. We're not going to cut nurses. We'll do whatever it takes to keep those 2 groups employed. But we cut the massage therapists. Our timing was not great right before Christmas, but that's the end of our fiscal year. This is what will happen if we get to the point in the bill where we have the mandated reimbursement side of things. I hate to use this term, but I'm going to use it. It's a term that's used a lot in the medical profession, especially on the administrative side of things. It's called healthcare economics. And what healthcare economics is where you have fixed payer groups in Medicare and Medicaid. And on this piece of the pie that you have 25% that are commercial payers. And not all commercial payers are the same. I should say it will be slightly less than 25% because you'll have cash payers there. But you have the individuals, the small group plans, the large group plans, the ERISA plans. They're the self-insured plans. I hate to say this, but we charge them more. Because the ability to deliver the services, the ability to keep the doors open 24/7, the ability to have high-level professionals who are wide awake, who are there, who are ready, costs money. As we heard from one of my colleagues earlier in this debate, early this morning, as a matter of fact, he talked about how two of his kids had gone to medical school, and they racked up incredible debt. The medical profession is not cheap at any phase at all. And to be able to say that you reach a point where you're looking at this pie, and you're like, okay, we know that certain people are going to have to be charged more. It's the redistribution. It's cost shifting. But what happens here with the policy that we're looking at today is it's another version of Medicare and Medicaid, which means that the area that you're shifting the burden to gets smaller. As a matter of fact, it's the large group plans, the ERISA plans, the cash-funded plans, or self-insured plans, I should say. Those are the ones who are going to be paying more. But especially when we look at the ERISA plans, those are also the ones we cannot touch. In Colorado, we have no control over that. But when businesses choose to have these, or labor unions, or other large associations, they do so because they can realize cost savings. I think we ought to be encouraging more of that, because they're able to work out rates with hospitals and build their plan with the carrier who's working with them to deliver the service and build it around what their employees' needs are. They can also work with their employees on certain health outcomes that are positive, such as having programs that are actually built in to help lower things like blood pressure or weight. And in turn, that also lowers healthcare costs for the plan. I do want to say that one thing that was talked about quite a bit in committee, and I asked this over and over again, are doctors and nurses in Colorado making too much money? And I followed it up with a statistic from the Brookings Institution that looked at all the wealthy nations in the world. And American doctors and American nurses by far make more than any other wealthy nation on earth. I asked this of proponents and opponents of this bill. And you know what the answer was over and over again in committee? It was a 12-hour-long committee, so we heard it a lot. No. As a matter of fact, the head of AFL-CIO for Colorado said, as a matter of fact, he would pay our doctors and our nurses more. No one said that our doctors and our nurses make too much money. They realize that this is an essential service that they're providing to Coloradans. A couple of ladies did give me an answer, though. They said hospital CEOs. Well, if you're a hospital that's not part of a special district, the top 10 salaries in your hospital under federal law have to be disclosed. So I took the prerogative in looking up the top 10 salaries of these different hospitals throughout the state, just to see where the CEOs ranked. It was interesting. I could not find a single hospital in Colorado where the CEO was in the top 10 list. Folks who were on the top 10 list, were almost always doctors. As a matter of fact, they were all doctors. I didn't find anyone who wasn't a doctor. But our doctors, under modern medicine, they provide miracles every single day. And they work under intense, stressful situations. And I believe they earn every penny of what other people may consider a large salary. I had the opportunity back in January to watch a surgery. I know I've referenced this several times because it's the first surgery I've ever watched and pretty intense. A lady had broken her leg skiing and had had an ACL earlier in life with the pin still in. It shattered. And the surgeon said to me, Matt, I just want to make sure you're going to be able to stand on 2 feet and not pass out on me. And I assured him that I'd been hunting and I had field dress, so I was pretty sure I was prepared. It was amazing to me watching some of the tools in the operating room. It looked like I was in a carpenter shop, only with bright, shiny titanium. What looked like zip ties were able to carefully go in around the bone, and the bone started to move together. He was able to put screws in very carefully, and he showed me how the technology of even the screws have improved to where different elements of the screws at different points of the threading twisted different ways to ensure that there was a little bit of movement in the bone. Things that you and I just would never think about. And he also told me how his dad had also been an orthopedic surgeon and had invented a template to be able to, because his father had seen so many surgeries, this template actually fits onto the bone to show the best location for certain pins. And that's still in use today. It was invented 50-some years ago.
Representative Silver, I'm going to very gently ask you to, I think I know where you're going, but I'm going to very gently ask you to get to the committee report here in a moment.
Oh, sure, and thank you, Mr. Chair. I appreciate the gentle nudge. But the point I'm making is that our doctors are well worth what they make. And the fact that no one in committee, both pro and con, said that doctors make too much, no one said nurses make too much, especially after the horrific year they went through in 2020, comes back to if we get to the price-setting element in this bill, where insurance is unable to meet the 18% reduction, and we now pass the authority on to the insurance commissioner, and we have these rates. It gets passed on to the hospitals. And yes, on paper, these may look like they could be pretty good reimbursements, but I am going to push back heavy here. Because a lot of this is based, like for example, critical access hospitals, that's a flawed federal government standard. Whoever got, single county hospital as well. Those are flawed government standards from the federal government based on who got that status first. You're able to block out other hospitals nearby. Which means that if you're going to tie reimbursement to these federal standards, they're being based on the fact that the federal law is flawed. To say that, for example, Delta, which is 35 miles from Montrose and 40 miles from Grand Junction, is not a sole community hospital, which would allow us to have a higher reimbursement rate, all because the cutoff is 34 miles. Completely arbitrary, one mile different. And this bill relies on those same flawed standards. And the fact that Montrose may be sole community for that community, but they're not a critical access hospital. These are the elements in the bill that I wish we could have come to some sort of an agreement on. If I could provide some constructive words as far as things to think about. As far as the essential access standard, 50 beds, 50 licensed beds is a federal government standard, and it's better than any other standard that's based on mileage. And I would suggest that 50 beds should be that cutoff point. If that were the cutoff point, you would take in the lion's share of the non-critical access rural hospitals, and they would also be included here. Otherwise, all that's included is the Telluride Medical Center and the Animas Surgical Center, which, by the way, the Animas Surgical Center, it's an orthopedic surgical center. Orthopods are your money-making generator for a hospital, for those of you who don't know. So an orthopedic surgical center does not need a higher reimbursement rate. If we're really talking who should and who shouldn't have higher reimbursement rates. I do want to move on to another element of the bill that I've heard a lot about. And that's when we're talking about doctors. The fact that a doctor has to take a standardized plan patient. Currently, a doctor does not have to take a Medicare patient or a Medicaid patient. And I believe part of this is based on the fact that the only other state to have a public option like what this was gearing to at first, and I know that this has changed slightly, but I believe that was because participation was probably low, and so this was a way to increase participation. But it's very difficult to tell someone they have to take a certain patient. There's no other state in America that requires a medical professional to take a certain type of insurance, from a standardized plan to Medicaid to Medicare to a commercial payer. You can elect to be part of it by being part of the network, but you don't have to be. And the election part is key. The other element that's really tied up in this, aside from the fact that it's a requirement that no other state has, is it certainly can have a chilling effect on the ability for rural hospitals to recruit doctors to come to rural Colorado to practice. Already, it's very, very challenging to get medical professionals to rural Colorado. I know this because it's very difficult for us already to be able to pay at a certain level. And for any other element that has a chilling effect on hiring doctors, such as telling a doctor that they have to be part of something, a doctor may say, you know what, I'm going to look to another state besides Colorado, or they will say, I'm going to work for a hospital that's part of a large system, a large healthcare system, which means when you go out west or you go out to the Eastern Plains, we have a lot of special district hospitals. And as you know, special districts receive a tiny bit in property taxes, although it depends on how big their mill is. But it was the ability way back in the day to be able to get a hospital to their county, because it just was not economical to have hospitals in these really remote rural areas. So citizens banded together and they said, we're going to tax our real property so that we can have a hospital that's open 24/7. And not getting into the Gallagher debate of things, but it's become very challenging because obviously those mills had declined. And now these rural hospitals are faced with the fact that doctor candidates will come in knowing that they have these hospitals over a gun barrel, and they will say, either I make top dollar or I'll go down the road. Well, you can say no to so many doctors before it becomes really frustrating with the fact that you can't get anyone to come out for the lower prices that we can afford to pay. So you end up contracting with larger hospital facilities, at least to have certain medical professionals at your hospital certain days of the week. But that element of the mandatory participation definitely will have a chilling effect. The other thing that is not really considered here is different doctors make vastly different amounts depending on what your practice and what your scope of practice involves. An orthopedic surgeon makes a whole lot more than a family doctor. And that's not considered in here at all. I don't know if it should or shouldn't be, but certainly within the hospital system. The other thing within the hospital system that is not addressed here is the fact that you have a lot of physicians who have privileges at a hospital, but they're not employees of that hospital. So you really are beholden to those physicians, but they're not your employee. So you can't fire them. I mean, you could deny their privileges. But it means that they kind of dictate what's happening there. And so to really block hospital-employed doctors, but not have the same treatment for outside doctors, definitely creates haves and have-nots in the system. And it means that you'll have more doctors that will also try to play the hospital system to make more money. I mean, that's really what people do. It's human nature. These are really the things that come to mind in this. I do want to, as I start to wind down with the points that I've heard a lot about, look at the advisory board. The governor is the sole appointing member, or sole appointing authority, I should say, for the members on the advisory board. There are several terms within the list that they're looking for on the advisory board that actually are not found elsewhere in Colorado law. I know this because I did a word search of our red books that we also called the Colorado Revised Statutes. So the phrase ability is not found in statute, but disability is. So I assume that this means disability. Otherwise, we certainly have a inconsistency with the law. When we look to person of color, there's only one other reference in statute where person of color is even referenced, and that was to a grant fund that was created in 2019. The term minority is what's typically used within our statute books. There is the phrase geography. However, we heard a lot of debate, including from the sponsors of the bill, that particularly in rural western Colorado is where we really saw a lot of the inequities. And I would love to see something that specifically spelled out that a member of the advisory board would be from both sides of the Continental Divide as well. The element of at least 1/3 of the members of the advisory board should be people of color. There's some challenging elements here with the fact that in statute there's just a passing reference to that, and nowhere is person of color defined here. I've heard a lot about this, so my statement here is actually a personal plea, to tell you the truth, from my wife. My wife is an immigrant from Taiwan. She is not a U.S. citizen. And she said to me, this is really troubling for me, because she said, am I a person of color? And I said, in the eyes of your husband, perhaps in this bill? I'm white. Yes. Then she said, are you saying I'm yellow-skinned? I said, I'm afraid that's what it means. And she said, I would rather be referred to as a minority. And I said, I don't know if I dare mention this. And she said, I've never asked you to say anything specifically for me at the well. But she said, I don't have a seat in the body. And I would like you to at least share my feelings. That's my wife's feelings. I will not comment any further. Mr. Chair, for these reasons, I will be opposed to the bill. But I certainly appreciate the sponsors' hard work on this bill. They have certainly had far more stakeholdering than the typical bill that we see here. And I know that many late nights, I've watched them, and certainly, I do want you to know that I appreciate you, and I appreciate you listening. I appreciate the fact that you've honored also the rules that we've set out here. I know you and I talked about that, and at least at each step of the way, you made sure that we had advanced copies so that we could be able to read and be able to fulfill our oath of office to represent our districts to the best of our ability, and you made that possible. So I do want to thank you for that. But I am going to have to be a no here. Thank you.
Thank you, Representative Soper. Representative Hanks.
Thank you, Mr. Chair. It's an honor and also rather onerous to follow Representative Soper on matters of medical expertise. I could probably listen to you all night there, Matt, on what you know. I want to read a letter here. It goes to what Representative Soper talked about coverage. Coverage falling away in the rural areas by virtue of people deciding that the practice isn't worth having. I've got a great letter from that, but I want to start it again just by the reminder of saying government cannot bring down the cost of health care. It can buy a smaller quantity or a lower quality. Here's a letter from a doctor. I'll redact portions of his name and where he works, but it's available for members of the floor to look at. It says, Dear Representative, I am a Douglas County physician working hard to take care of Coloradans. I spent the last year intubating COVID-19 patients and caring for them in the ICUs and operating rooms throughout the metro area. It has been a terrifying year, worrying whether I will bring sickness home to my wife and children, but I did it because it is my duty to care for the sick, regardless of personal cost. The Colorado House is going to consider House Bill 21-1232 this week. It is bad for Colorado and will drive my practice and many like it out of business instantly. I agree that healthcare costs are too high, but this bill does not fix the problem. It only slaps a fresh coat of paint on the problem while driving doctors and nurses out of our businesses of helping the sick. The immediate effects will be to close many physician groups at a time when Coloradans need doctors the most. The long-term effects will be to make Colorado healthcare lower quality and much less competitive. Our state medical society anticipates that healthcare professionals will retire or move, and that the new physicians being brought into the state will be lower quality, i.e., the ones who could not get a job elsewhere. Colorado needs better healthcare, not worse. In the final innings of the COVID-19 pandemic that has killed so many of our neighbors and friends, why would the House pass a bill that is a slap in the faces of physicians who have been working tirelessly to care for others? We want to help with the solution, but this bill will not do it. This bill is opposed by every state physician professional group and healthcare organization that I know of. Please work with us to find a better solution than this. I'm available by phone or email. Please contact me. Thank you for what you do for our community, and that's Dr. David B. And I would say to the good doctor, thank you for what you do. I think we heard a lot of testimony in the Health and Insurance Committee, both during the 12 hours and during the for action only, where still a fair amount of information and commentary was covered. And I really do think we need to defer to subject matter experts such as this doctor. There's a problem as well, and I might abbreviate some of these comments here just for the sake of time and daylight. But Dr. Soul made a good comment that I wanted to include with some of the other quotes I've attributed to him, and it's third-party payments are at the heart of much confusion about the cost of medical treatment and are a major factor in the increased cost of that treatment. In government-run medical systems, the public pays in taxes for its medical care, either wholly or in part, with a share being paid directly by the individual patient. Political slogans about bringing down the cost of medical care are almost invariably about programs or policies directed towards lowering the price paid directly by the patient. But the fact that Let me start again on that. But the fact that only part of the costs are reimbursed by direct out-of-pocket payments from individual patients to doctors, hospitals, or pharmacies in no way indicates that the total cost of the particular medical treatment is any lower than before. When the public pays part of its medical costs in taxes that the government uses to subsidize medical treatment or in premiums paid to health insurance companies, none of that lowers the cost, the total cost, in the slightest. To the extent that the direct payments by patients are lower than they would be if they had to cover the full cost, medical treatments tend to be sought more often, and that alone is enough to cause the total cost of medical care to rise, not fall. Whether these lower payments are due to price control or to supplementary payments by insurance companies or the government, the net result is that the lower prices tend to cause more of any goods or services to be demanded, including medical treatment. This is important here. I'd ask for particular attention. To the extent that third-party payments require a bureaucracy to administer these payments, whether a government bureaucracy or a private insurance company bureaucracy, the people in these bureaucracies have to be paid, adding still more to the cost of medical care. I'll leave it at that for now. I'm going to pick some of the best nuggets out of these 29 parts and bring them forward at a future moment. Thank you.
Representative Carver.
Thank you, Mr. Chair. I received numerous letters from doctors in my community of many different specialties, many different political philosophies, and I'll just read a couple while omitting the names for their privacy. I am a surgeon in Colorado Springs. We met in Denver a year ago at the Colorado Society of Eye Physicians and Surgeons breakfast reception at the University Club. And we had made plans for the doctors to get together to speak with you until COVID killed that. I work with patients every day that are concerned about high health care costs and their desire to find more affordable quality options. But House Bill 21-1232 is the wrong prescription for Colorado. I'm sure you are getting a lot of heat on this bill and from Mr. Polis, he means Governor Polis, obviously, who I voted for. This is the gentleman in question, the doctor, who I voted for and still support, to support House Bill 1232. But this bill will definitely hurt Colorado medicine. You simply cannot mandate physician participation and have a workforce that will want to take care of patients. There are no commercial, state, or federal health benefit plans that require mandatory participation. And this mandate is a step too far. We've poured out our heart and souls for our patients during this pandemic, and mandatory coercion of burned out and demoralized physicians who have been on the front lines for over a year won't make for a sustainable health care system. Health plans already hold all of the power at the expense of community physicians like me and the patients I serve. The bill provides even more leverage to highly profitable health plans to only offer take-it-or-leave-it contracts to physicians. Under this bill, corporate executives and shareholders will continue to profit at the expense of physicians and patients. House Bill 21-1232 will make it harder to recruit and retain new docs in Colorado. It will actually cause workforce problems because of its mandatory participation provisions. Please vote no on House Bill 21-1232 Colorado option on the House floor and help the docs that are trying to help your constituents. Thank you for listening. I got that email yesterday. One other one that I wanted to read is from an ophthalmologist in Colorado Springs. Dear Rep. Carver, I'm astonished that it is actually being debated and considered as the details of this bill become available, referencing House Bill 1232. I am a practicing ophthalmologist and have provided care to everyone in the most cost-efficient manner, regardless of need to pay or ability to pay. I have provided care to tens of thousands of patients since 2008, and I have performed countless surgeries for free because it is the right thing to do. All physicians are aware that there are problems with the healthcare system in the United States and even in Colorado. They are extremely complex issues, and I have studied them at length. There are, in my opinion, important steps that need to be taken. However, having the government fix prices and force doctors to participate is certainly not one of the solutions that my colleagues and I would consider helpful. And I'm confident it would have the exact opposite effect. Insurance companies will continue to take their profit, and the actual providers of the health care will be the ones to lose the most. Without a doubt, this will lead to the retirement of physicians and surgeons, de-incentivize healthcare workers who are already overworked, and further demoralize them in an already unprecedented situation of the pandemic. There is no precedent for this type of bill in any state or federal government. There is good reason for this. It is price fixing, forced labor, and government intrusion at its worst. I am willing to be part of a serious discussion on things that we can do to improve the healthcare system. I'm vehemently opposed to this bill and urge you to vote no. I received scores of emails yesterday and today on 1232, the strike below, which it makes up the committee report. Again, doctors of every specialty and every political affiliation from my jurisdiction. They have told me they don't know of one colleague that isn't opposed to 1232 and their sincere belief that it will cause serious harm to our healthcare system in Colorado. I ask for a no vote.
Representative Rich.
Thank you, Madam Chair. I would like to move Amendment L070 to amend the Health and Insurance Committee report and ask that it be displayed.
Thank you, Representative. Amendment L70 has been moved, and we're just waiting for it to be displayed. There it is. Please tell us about the amendment. Go ahead, Representative.
Thank you, Madam Chair. This amendment would change the way the advisory board is elected. I worked in local government for 16 years, and I don't recall when an unelected person in county government elected members to a board, especially a board as important as this. We have several bills where boards are elected or that they are chosen, and this would change, this particular amendment would change that to the way other boards have been appointed. This would allow the Speaker of the House of Representatives and the minority leaders of the House and the Senate to appoint 3 members, not just the governor and an unelected insurance commissioner. I don't think it's asking too much to allow us to have a voice in the members of this advisory board, and I ask for an aye vote.
Any further discussion on Amendment L70? Seeing none. Division has been called.
Speaker of the House. I'm not for that.
I don't like those things.
All right, members, the question is the adoption of Amendment 70 to the committee report. A division has been requested. All of those in the chamber not entitled to vote, please be seated. All those in favor of Amendment 70 to the committee report, please stand and remain standing or raise your hand and keep it raised until the count is taken. Mob. You may be seated. All of those opposed, please stand and remain standing in one place until the count is taken, or raise your hand, particularly if you're on screen. You may be seated. Amendment 70 is lost. Back to the committee report. Any further discussion on the committee report? Representative Van Winkle.
Thank you, Madam Chair. It's been so quiet in here. I appreciate the smattering of discussion. I have an amendment here. There you are, Robin. And so I move to amend the Health and Insurance Committee report dated April 27, 2021. I move L077 to that committee report.
L77 has been moved and is displayed. Representative, tell us about the amendment.
Thank you, Madam Chair. And so what this amendment does is on or before January 31st, 2022, so essentially a year after this program gets up and off the ground here, the commissioner shall prepare a report that details the impact of state-mandated health insurance benefits that are not included in the Essential Health Services Package. Essentially, what this does, it's a reporting mechanism that will be extremely important to the people of Colorado and to the policymakers here in, I guess it would be in the policymakers that come back to this building the following legislative session. It will be entirely important to get this report and be able to analyze it, because from my analysis of this bill and the math in it, and actually it's not my analysis, it's people much smarter than me, some actuarials have done the math on the bill, and they've used the provider reimbursements in the current bill to assess if these rates would result in insurance premium reductions for members. And most often, members, the answer that has come back from these very smart actuarials is no, because the numbers don't add up. The actuarial analysis shows that if the public option bill were to pass with the current provider reimbursement formulas, the resulting premiums would mean that members in 1/3 of the 9 Colorado regions would not see premiums reduced by the required 6% in 1 year. In year 2, the second year, members in 2/3 of the regions served by this company that has over 1 million Coloradans as clients would not see rates reductions of the required 12%. In fact, in some areas, there are concerns, and these are concerns, like I said, by people much smarter than even me, of the actuarials. They are, in fact, believe that premiums would increase for existing plans because companies have already negotiated a lower reimbursement level with providers. So will premiums come down under House Bill 1232? The answer is no. I can discuss this more as the evening goes on here, but for now, going back to the amendment at hand, L077, I ask for a yes vote because really this is a simple reporting mechanism. There should be a report on this specific topic that comes back to the people. Well, I guess the people of Colorado can read it, of course, because it's public information, but at least it would come to the public and the members of the Health and Human Services Committee in the Senate and the House. Those are the members that first saw this bill. They're the members that are the experts in this bill, and so they can look back after assuming that the bill has passed and say, is this working, is this not working, what needs to change. It doesn't kill a bill, it doesn't change anything in the bill, it's simply a report that will come to the policymakers, and not all 65 of us or 35 senators, but to the key members and those public health and human services committees. And so with that, I ask for a yes vote on this simple report.
Representative Roberts.
Thank you, Madam Chair. Thank you, Representative Van Winkle. I appreciate your desire for transparency and accountability. This is in the bill already in several places. First, the bill requires that the commissioner do an actuarial analysis every year when in analyzing this plan, and there are SMART Act reporting requirements in the bill. So the Health and Insurance Committee will get a public report every year on this plan. This is already in the bill in several places. So I agree with you, Representative Van Winkle. I just don't think this specific amendment is necessary.
Mr. Minority Leader.
Thank you, Madam Chair. Your lips to God's ears.
Just keep dreaming.
Has there been an actuarial study? Because if it's in the bill, that is super good because it's important. So have we done an actuarial study on the percentages that are in the bill to be reduced and the reimbursement rates for the financial health of the institutions or the healthcare providers?
Representative Roberts.
Thank you, Madam Chair. Well, you can't do an actuarial analysis on the future, but there was a actuarial analysis done as the result of a bill that this body passed, House Bill 19-10-004, that analyzed what the reimbursement rates needed to be and what the impact would be. That's out there, that's public, and anybody can access that.
Mr. Minority Leader.
Thank you very much, Madam Chair, and thank you, Representative Roberts. And I'd just like to note for the body that actuarial analysis was done as a result of a 2019 bill. We've had some rather significant changes in the healthcare industry since 2019 and even the very early months of 2020. And so therefore, if what we're looking at is an actuarial analysis back in previous days, before the COVID epidemic, before some of the enormous costs that hospitals and healthcare providers have had to take on, and we're basing reductions off of that, then I think not only is this analysis and this study and this report not only a good idea because it specifically calls out the actuarial basis for the stability of the rate reductions, but I think it also behooves us to demand the same kind of financial analysis on the very things that are in this bill as of today.
Any further discussion on Amendment 77? Representative Hanks.
Thank you, Madam Chair. I was struck by the line 6 on Amendment 77. The report shall analyze the financial impact of the mandates and any policy mandate changes to the cost-sharing elements of health plan benefit design. It's instructive to figure out how we got where we are and why something like this is necessary. There is a little bit of history, I think, that's important. The private system of the particular system of private third-party payments for medical care in the United States with health insurance provided by employers was a fortuitous consequence of tax laws and wage controls during the Second World War and had nothing to do with any special qualifications of employers to deal with medical care issues. Because employers were prevented by wage controls from rising pay rates to attract more workers during labor shortages, they resorted to increased fringe benefits to achieve the same results. I point that out because I think it has put us in a ditch, frankly. I mean, perhaps I'm a bit of a romantic here. That may come as a surprise to many people, but I do kind of like the good old days when medicine was between a patient and his doctor. We got here because of wage and price controls in World War II. Now we're looking at doing a Colorado government plan for medical care. It just sounds like we're throwing more lead on a worn-out horse here. I don't think this is a good idea. So if this ends up being part of what we're saddling Colorado with, we ought to at least have some analysis on the financial costs. I urge a yes on Amendment L077.
Rep. Van Winkle.
Thank you, Madam Chair. And I know actuarials actually can take a look at the math in the past performance and future predicted performance, and they can look into the future. That's actually exactly what they do. In fact, with PARA, the Pension Oversight Board Committee, we use those things all the time. PARA uses those things all the time so we can predict, will the people of Colorado be able to depend upon this retirement promises that we have made as a General Assembly long into the future. And I believe in this case it's even more impactful because as this study showed that only one region would see, if this bill were to pass, or one region would see a 0% premium reduction. That means regardless of the insurance premium reductions percentage required in the legislation, premiums would not decrease because of the provider reimbursements delineated in the bill. The math just doesn't work. Furthermore, over the past several years, companies like this, one that has over 1 million clients in Colorado and others, has introduced health insurance plans that have reduced premiums by 15 to 25% each. So they heard and have listened to their customers, they've listened to policymakers, they've listened to the people, frankly, of America and said, we do need to do something, we can do something, and so they have reduced premiums on many of their things by 15, 20% already. That may prove to be a mistake if we pass a bill that says you must do it by another 18% for a total of 45 to 50%. That would necessitate cutting providers or services in most cases, and as we heard this morning from another company, not this one that has over 1 million, but I guess they've already been mentioned as well, Kaiser, which many of us actually see. They would have to eliminate their hospital coverage just to make ends meet because they couldn't pass those costs onto customers at a big enough pace. So with that, I urge a yes vote on L077. Let's get this report done, and I do appreciate the bill sponsors putting reporting mechanisms and smart act hearings into the bill already.
Any further discussion on Amendment L77 to the committee report? Seeing none, question before us is the adoption of L77. All those in favor say aye. Aye. All those opposed, no. No. Noes have it. L77 is lost. Representative Pelton.
Thank you, Madam Chair. You know, kind of the way the Eastern Plains is set up with critical access hospitals and very, very few employers over 100, Initially, I can see how this will kind of bypass the Eastern Plains to start with. But I think things will change as this thing comes into play and the economics and dynamics start to take over. But there's one group that I would really like to kind of protect as we go about this. And so with that, I move L072 and ask to be displayed, please.
Amendment 72 has been moved and it's displayed. Tell us about the amendment.
Thank you, Madam Chair. What this amendment does is it exempts co-ops. Before I was elected as county commissioner, my family was a member of Christian Medishare. My oldest daughter and her family still is. It was excellent for my family. It worked great out in rural Colorado. Co-ops, I think we could learn a few things from in providing health coverage for our citizens. So with that, I really like this amendment, and I'd like to get some support and get it on this bill, please.
Any further discussion on Amendment L72? Representative Roberts.
Thank you, Madam Chair. Representative Pelton, I appreciate co-ops. There are very successful co-ops happening all across our state. The language that you're trying to strike is the language that protects co-ops under this bill. So I think this amendment would have the opposite impact of what you prefer. If we struck this language, if we adopted this amendment, co-ops would not be protected. I ask for a no vote.
Any further discussion on Amendment L72? Representative Pelton.
Thank you, Madam Chair. And I kind of read through that section, and I guess I didn't really get what you're saying there. So could you explain that just a little further for me, please?
Representative Roberts.
Thank you, Madam Chair. I appreciate the question, Representative Pelton. What this language says is that in areas or counties where there is a co-op, then that county is considered compliant with the goals of the price reductions in this bill, so that they wouldn't have to be subject to some of the other provisions of the bill because they have a successful co-op in that county. That's considered an adequate competitive insurance option for those residents.
Pelton.
And I guess to clarify that a little more, say if there's only a couple families in a whole county that has a member of one of these co-op plans, does that qualify as a county having a co-op plan?
Roberts.
Thank you, Madam Chair. Yes, I think if the co-op is achieving price reductions compared to the private market, then that co-op is compliant under the language in this section.
Any further discussion on Amendment L72? Seeing none, the question before us is the adoption of Amendment L72. All those in favor say aye. Aye. Opposed, no? No. Noes have it. 72 is lost. Back to the committee report. Representative Lynch.
Thank you, Madam Chair. I miss your sidekick.
She had a lot to say tonight, so I left her at home.
Good evening. Not a finer group of people I'd rather spend the night with than my newly found 64 friends. Hey, usually when I get feedback on bills, I take it pretty serious. I kind of weigh out how many fors, how many against, what's kind of the climate. And as a lot of you know, there's a lot of people that do a lot more research into these issues than we do, primarily because it's their livelihood that we're dealing with. And I'll tell you, the majority of the pushback that I got on this was not from average ordinary citizens, but people that are actually involved in the medical field and people that were that feel that they're going to have their livelihood affected by our ramifications of what we do with this bill. And my fear is that if we try to be trailblazers and try to do something that no other state has done, which I think there's a lot of components of this that fall under that, we could be the first nation to also have a large percentage of our medical staff and doctors move out of this state. And this is a place where a lot of folks want to live. because they love Colorado for all the reasons we do, and that leads us to get some of the finest people in the country. I want to tell a story. I've got a small business, and a number of years ago when we first started, I say we as a country started messing around with healthcare. At that time, I believe I had 13 people working for me. My wife worked for a Fortune 500 company, and I was able to offer to my 13 people just as good of benefits as my wife working for a Fortune 500 company was receiving. And that was a real point of pride. At that point, my business was, I believe, 30 years old, second generation. And it was a real point of pride that when we would hire somebody, they would be covered. We had a couple of babies born under that plan. A couple of my babies were born under that plan. And then the government started monkeying around with health insurance. And I used to tune into the radio or TV, and I would hear people complaining that, oh my gosh, my medical expenses went up 10, 15%. I will tell you, mine went up 110%. And it also put me in a position as an employer where I could no longer offer to my employees one of my greatest contributions and one of my biggest points of pride in offering to them the best health care that you could buy, really. And it wasn't breaking the bank. But I made that decision to do that and offer that up because I care about my employees, I care about their health, and it allowed me to also retain great people. And once we started monkeying around with it, all that went away. So back to this amendment, back to the report. We're putting a whole lot of responsibility onto, which is in essence a whole nother branch of our government almost. What a big job to have an appointed commissioner, appointed by the governor, really overseeing what will become our state's largest endeavor. And so what I would propose is a pretty common sense thing. We as a body would have no real oversight over that commissioner. We could not hire him and fire him as far as I can tell. So what I would like to propose, pretty reasonable, is that person actually becomes an elected official and becomes accountable to the people. So, Madam Chair, I'd like to move L068 and have it properly displayed.
Thank you, Representative. Amendment 68's been moved. It's displayed. You told us about it, but if you want to add anything.
So real simply, it just strikes the language out that this commissioner is appointed by the governor, and we now create an elected position for this commissioner. I think it makes a lot of sense to have accountability put into the hands of the people and not at the whim of the governor. I would strongly urge you to consider this. I just think it's always better when we give the power to the people, especially in something as important as their health care and what we're asking this legislation to do. I think it should definitely have the oversight of the people. So I would urge a yes vote.
Representative Pelton, then Rich, then Ransom.
Thank you, Madam Chair. I can't rise up with enough enthusiasm for this amendment. How many times since March of 2020 have we heard, man, this thing's being run by unelected bureaucrats? People are sick and tired of unelected bureaucrats. And with individual that is going to be given as much power through a bill as this commissioner is through this bill, I think it only fitting that we elect the insurance commissioner in the state. And with that, I rise in support of this amendment.
Representative Rich.
Thank you, Madam Chair. I also rise in support of this amendment, pretty much for the same reasons that my colleague just spoke to. It makes me uncomfortable that we have an insurance commissioner that, of course, is unelected, but he's hired by the governor. And when I tried to run an amendment, it was about, trying to spread out that appointment of the advisory committee. But I think it's only fair that we elect who's going to run such a major part of our lives, which is our health care. So I ask for an aye vote.
Branson.
Thank you, Madam Chair. And I know I've spoken many times at this well since I've been here about the fact that we are accountable to our bosses, our constituents, the people that elect us, the people that send us here. I think we all want to recognize that we have people that are out in their districts, out in their homes, working, raising families, and they elect us to represent them. With that, we have a responsibility to be responsive to our constituents, to the people that send us here. Having bureaucrats that are running huge parts of the government, huge parts of, when they have the ability to change lives as drastically as one person would have with what's being laid out in this legislation, is probably going to cause fear in many people that are aware of what's going on. That being said, I don't want to be critical of any one person. They might have the best of intentions. They might have the best of reasons for making the decisions that they do. However, they are not responsible to the voters in the same way that an elected official is. And I think it's very important that we recognize that as elected officials, we have to go back to the voters periodically to get reelected, to come back here, or if the voters don't like what we're doing, they have the ability to then end our tenure here at the Capitol. Having a hired person that is basically part of the huge bureaucracy that grows every single year. I have seen it grow hugely in the years that I've served in this body. Having one person that is hired and may be here for who knows how long, and they are hired by a person, and the commissioner would not have the same responsibility to the citizens of Colorado that we do. And I think this amendment is actually a great idea and a huge improvement on the bill that we're considering this evening, because it would then let the voters weigh in on differences, changes, things that they see coming out of House Bill 1232, whether positive or negative, whether helpful or not helpful to their business models, their medical practice, or whatever else they do in the realm of medical practice. But having elections to bring the person I've actually seen them referred to in the media as the czar, so the health czar, it would just make a lot of sense to change that to an elected position to where there would be some responsibility to voters, some accountability to voters, and then that person would actually end up wanting and having some good incentives to make decisions that serve the people of Colorado, that serve the citizens that are out working, that serve the citizens that are truly depending on us to let them stay working. And not want to leave the state. Clearly, our goal is to help Colorado, build Colorado, increase Colorado, and having elections periodically for this commissioner would be just a stroke of genius from everything I can see as I read this bill, as I read the new bill, the strike below, the committee report, to just let the voters weigh in periodically on what that commissioner is doing in the healthcare world. With that, I urge an aye vote on the amendment.
Representative Hanks.
Thank you, Madam Chair. Yes, I rise in support of Amendment L068. It is simply calling for the commissioner to be elected. I've often said from here and in the home district that thank God for term limits, thank God for part-time legislatures, and in this case, thank God for elections. We ought to hold people's feet to the fire, and we ought to allow them the opportunity to get a vote of confidence or to be drummed out. And I think the people would like to see more of that. We've talked about safety clauses in the past versus petition clauses. This sort of eliminates that issue, at least as far as commissioners go, and it makes a lot of sense to me. I think it makes a lot of sense to people back in the home district. I'd urge a yes vote.
Mr. Assistant Minority Leader.
Thank you, Madam Chair. And members, I rise in support of L68 as well, or L068. My apologies. And you know, I think if there's anything that I've learned in the time that I've spent here in this chamber and with this body, is that the voice of the people sometimes they don't feel that it's necessarily heard. At least, you know, in my district, I can certainly speak for myself here. The idea that they may have the ability to weigh in specifically through the power of the ballot, I think speaks very loudly, not just to them, but for all people across Colorado. And that's what this does, right? L68 is a matter of accountability for those that would have a huge impact. And I think Representative Ransom was accurate, or was incredibly accurate when she talked about the bureaucracy, right? I mean, this 1232 is potentially a bill that will have a massive impact, but knowing that there is someone that is accountable, that commissioner that would be accountable to the people through the power of the ballot, is certainly something that I think would put a lot of folks at ease, because they would be able to express their voice most directly in the most direct and most powerful way that we do here in our republic, and that is through the power of the ballot. L68 or 068, I think, does a phenomenal job at ensuring that the people's voice is heard directly. And if there is something that, you know, the people of Colorado are, you know, end up becoming, you know, mistrustful of, or that they disagree with, and the direction that it may go is taken by an appointed or a placed commissioner, this is a way that we can make sure that the people's voices continue to be heard. So I would urge a yes vote on L068.
Any further discussion on Amendment 68? Representative Will.
Did you forget who I was, Madam Chair? It's an honor to serve with you.
It's an honor to serve with you.
I stand in strong support of this amendment, L068. I think the commissioner is going to have a lot of power in this under this bill, and I truly think he should be elected, because then he has to listen to everyone. And it's been said up here before how important this is, and that this official be elected, I think is something that really this bill really truly needs, because he has so much power promulgating rules and doing all that. I just strongly suggest we pass this amendment. Thank you.
Any further discussion? Representative Weissman.
Thank you, Madam Chair. I actually find this a rather fascinating amendment. Believe it or not, it's something I've thought about, and I think if you look at other states, I believe that some states do have an elected insurance commissioner. I think this is not entirely without precedent. You know, it is an important position, and I think it needs to be accountable to people. I think the fatal flaw here, and why I'm going to strongly ask for a no vote, is that members look at the pressures being brought to bear on this debate. I don't want that pressure brought to bear on those elections. I think that would be catastrophic. I ask for a no vote.
Branson.
Thank you, Madam Chair. No, I do not. I actually disagree that it would be catastrophic to have an election for the commissioner. When we look at the responsibilities that are laid out in this bill, they actually have a huge amount of responsibility that is not parallel to, but in certain areas it will be equivalent to the other statewide elected officials that we elect on a periodic basis. And to have an election of this person, it would just be the commissioner themselves. They would still have their full staff. They would have the staff that runs the office, that keeps the office functioning. Those people would not be subject to election every 2 years. It would be just the commissioner themselves. And I do not see a catastrophe in making that person responsive to the people of Colorado by any means. I urge and I vote on this amendment.
Representative Judah.
Thank you, Madam Chair. Members, we have a check and balance system in this state. The governor appoints the commissioner, and the Senate, which is our elected body, which we are talking about, has the power to confirm. So I ask for a no vote.
Any further discussion on Amendment L68? Seeing none, the question before us is the adoption of Amendment 68 to the committee report. All those in favor say aye. Opposed, no. Noes have it. L68 is lost. Back to the committee report. Rep. Ransom.
Thank you, Madam Chair. Some of you may not know that I have 2 hospitals in my district in northern Douglas County. Because I have 2 hospitals in the district, that also means that there are a fair number of surrounding medical offices. As you know, many hospitals have wings of doctors' offices and medical practices that are attached to the hospitals. And also, there are nearby medical practices that function within my district. And of course, that means I have a lot of constituents that are affiliated and associated with the medical field in some form, fashion, or another. Whether they're doctors, nurses, administrative staff, all of the various outworkings of medical offices, many of them are my constituents. I have been hearing from them since long before this bill even dropped. I've heard from them actually when we had an election on a single-payer health system several years ago, which of course was defeated soundly by the voters who let us know that they did not want a single-payer health system. This is different. This bill, House Bill 1232, I understand is not a single-payer system. That being said, I still am very much in tune with my constituents, especially the ones that work in hospitals or doctors' offices or in some affiliated industry or side. One of the emails I got is actually, I hope it chills your bones when you hear what this doctor said, and I will not say his name for privacy reasons, but if any of you want to look at the email, I'd be more than happy to let you look at it if you check in with me at my desk after I read this. So, good morning. Thank you for your kind attention. I am writing you today regarding the Colorado option health benefit plan legislation. As an anesthesiologist practicing in Colorado for the past 13 years, I have had the privilege to participate in the wellness of our diverse and active population. I thoroughly enjoyed living and practicing in our great state. It is with great alarm that I have been following the progress of this piece of legislation to its current status. While our group, and he told me the name of his practice, has cost reduction and efficient delivery of services as a cornerstone tenet of our incorporation, the Colorado option represents a death knell to innovation and partnership with physicians in our state. From an anesthesia perspective, there has been a long-standing disparity between Medicare and Medicaid reimbursement rates for anesthesia services in comparison to primary care and other specialty physicians. This legislation will further amplify the problem. We rely on fair commercial insurance reimbursement rates to help balance out the significantly lower, often 40% or more, Medicare/Medicaid rates paid for anesthesia services. Our balanced approach allows us to care for all Coloradans, but this Colorado option will further upend our ability to keep our practice solvent. While I applaud the endeavor to reduce waste from the insurance companies recording billions of dollars of profit a year, the Colorado option reductions will simply be passed through to us, the physicians. Taking a 10% and subsequent 20% cut to our reimbursement will, in all likelihood, drive talented physicians from our state, creating a medical wasteland. If this bill is passed, I will personally have to consider relocating my family to a more physician-friendly state. In closing, I want to record my deep opposition to this legislation and to persuade you to please vote against it in its current format. Lower cost but lower quality health care is bad for everyone. Please help keep Colorado healthy and vibrant by voting against this bill. Thank you for your consideration. Best regards. And this is a doctor in my district. So I just want to, I hope that this makes everybody think twice. He would plan on leaving the state or seriously consider leaving the state and relocating to a more physician-friendly state. I hope that that is not something we are leading up to if this bill indeed is adopted by this body and again adopted in the Senate. Scaring doctors away from the state because we are continually requiring them to meet our definition of what rates should be is not our purview, and it's not something we should be doing here in Colorado. When we think about it, since when can one elected and this is back to the commissioner that will now be hired by and appointed by the governor, as stated. Since when can one unelected and unaccountable person have the ability to say to a doctor or hospital, I'm going to have to take a closer look at your license unless you provide services at a price I like? How would any of you in business like a similar commissioner to scrutinize your business decisions and have the power to put you out of business at the same time? The committee report has a section regarding rates, and the commissioner would disapprove requested rate increases if certain conditions apply. This is on page 16. With that, I move L081 and ask that it be displayed.
Boom. Here we go.
Thank you, Representative Ransom. Amendment 81 has been moved. It's displayed.
Oh, yeah.
And tell us about your amendment.
Thank you, Madam Chair. This bill would simply remove the rate filing approval from the bill. Every other part of the bill would be intact. You can see it's a very simple amendment. It would just allow, as I was mentioning, the fear that is moving through medical professionals in our state right now, or I should say doctors in my district, the fear that is moving through their families and homes right now. This would help, I think, alleviate a lot of what they are concerned about by having the rate approval be resting within one person. I ask for an aye vote.
Representative Pico on the amendment.
Thank you, Madam Chair. I rise in very strong support of this amendment. One of the key pieces of this entire problem has been arbitrarily setting the rates and arbitrarily setting the rates below the cost of service. As it is right now, Medicaid, Medicare, TRICARE pay below cost in a lot of cases. And physicians and hospitals have to manage how many patients they accept. You cannot set arbitrarily the rates for the providers without destroying the healthcare system. I ask for an aye vote.
Any for discussion on Amendment 81? Seeing none, question 4 says the adoption of Amendment 81. All those in favor say aye. Aye! Opposed, no. Amendment 81 fails. Back to the committee report. Representative Van Winkle.
Thank you, Madam Chair. I think I have the one right here. Right here. This is the one, members. Get ready. You're excited. I know you are. You're excited too, Matt. You want to turn in for me? Sure. Thank you. Bipartisan support here. He committed to voting yes. Members, this amendment, and I move L106. That's right, 106, which means this is the 106th amendment that has been drafted. Thanks for your support. It was momentary, but meaningful. And what this does is pretty simple. It removes the safety clause in the bill because the bill actually will take quite some time to implement anyway and get up and running anyway. And what it replaces the safety clause with is a petition clause. And for those of you watching at home, the petition clause allows, if there is a bill that frustrates enough Coloradans, and it takes a lot of Coloradans, citizens on their own can go to each congressional district, gather petitions, get enough signatures on a piece of paper saying, no, this needs to go to the ballot. And what it would do, it would send it, if that enormous effort was undertaken and was successful, then this bill, once passed, would go to the voters in November of this year to be voted yes or no. As far as the timing goes, there shouldn't be any harm to this because, like I said, the bill does take some time to implement. And I understand we wanted the commissioner, the head honcho over the entire thing to be elected. And that was something that the bill sponsor said, no, that's not acceptable. And the representative from Aurora, he gave an eloquent speech as to why. Representative Weissman, I'm sorry. The chair of Judiciary Committee, he gave an excellent speech as to why that's not acceptable, but this allows the people of Colorado on something that impacts their very health, their lives, their well-being, their kids' lives, their for future generations, all lives. It allows them on this most intimate of issues to say yes or no to whether this bill should pass. Now, I will quote Thomas Jefferson. Thomas Jefferson doesn't get quoted enough here in these hallowed grounds. And he said, the Constitution of most of our states and of the United States that asserts that all power is inherited in the people, that they may exercise it by themselves. It is their right, it is their duty. Let us listen to Thomas Jefferson. Let us allow the petition clause to go on to this bill. And let this amendment, L106, pass.
Minority Leader McKee.
Thank you, Madam Chair. We've all heard, and in the presentation leading up to this bill, we heard that, you know what, this is not an immediate problem, right? This is not an immediate thing. We've pushed the date out in this, out into the future. We've pushed this date out so that everybody has a chance to get all this stuff right. So really, there's no need for a safety clause. There's no need, because this does not, in the bill, happen until the future, pretty far into the future. And so we have the ability to put on a petition clause, keep our word to the voters of Colorado that, you know what, we do not operate here as if we're in an ivory tower. Tell us if you like it, tell us if you don't. The don't is, are you upset about it enough to go and petition this and put it back on the ballot? We saw that. We saw that recently, one of the first times I can remember. But we do not have an urgency of time in this bill. I urge an aye vote.
Representative Sandridge.
Thank you, Madam Chair. And sometimes I wish we could go to the Colorado Channel and just cut a piece off and just replay it. And because I've said this speech so many times, it just seems like I could just, or bring it. It's a good speech. You want to hear it again? I do. I don't remember it. It's one of those speeches you just can't get enough of. You just ask for more. I mean, so it's like most political speeches. Most of the crowd out just say, just keep on going. I love it. I love it. But so I know sometimes I think we come up here about and discuss the safety clause on really important and politically charged bills. Also bills that not everybody's on board with. I know sometimes we discuss the safety clause on bills where you think, there's really, the community's not going to come out and get the signatures and really do it. But I think in this bill, this is a big deal. And you all, and as well as myself, has received a lot of emails against this bill, or with concerns. And like I always say, our names are representative. We're supposed to represent our district and the people of Colorado. And sometimes it comes to a point where there's a lot of conflict on a bill. You wonder if you're really representing them the way you should be. So I think at that point, it's good to kind of push the responsibility off on them and have them make the decision. So I think it's really important to respect the people who we represent. And I know we all live in areas where some people contact us and love this bill, and some people contact us and don't and have concerns. And I think on something like that, we need to give them the final say in what goes on. Because as well as my constituents, I am concerned. And I think sometimes it takes the pressure off, I hate to say it, off the elected officials when we kind of push some of the responsibility off on them. And I think with the safety clause, we give them, when we put on a petition clause, we give them, our constituents, the final say. And I think on something that's controversial, they would appreciate that. They would appreciate that even if they don't use it. Some of our constituents think it's kind of almost a sacred right for them to be able to override us with some signatures. So on something like this, something so controversial, something where it could actually lead to doctors leaving, it could actually lead to maybe a hospital closing down, we need to allow our constituents to express their concerns if they choose to. And yeah, will they actually get the signatures? Will they take the initiative? I don't know if that's really the point. I think the point is that we allow them to have this. And there's no huge rush to implement this bill if it does pass and become law. There's no huge rush to the point where we need to override their right to override us. So with that said, I think we should really work harder in representing our districts, representing our people, and give them the final say in this bill if it does pass. And I think that's the least consideration that we can do is pass this amendment, put on the petition clause, give them the final say. I think that show respect to every Coloradoan. So I ask for an aye vote. Thank you.
Representative Van Winkle.
Thank you, Madam Chair. And forgive me, I'm not entirely sure this is going to pass, so I want to speak again on it. because it is important. It is about the future of our state. It's about our kids' lives and our grandkids' lives. And once again, members, if you don't listen to me, listen to Thomas Jefferson, because like I said, he said, and he's much smarter than I will ever be, the Constitution of most of our states, and that includes Colorado, and of the United States, asserts that all power is inherited in the people, and that they may exercise it themselves. Allow Thomas Jefferson to enter this conversation, and let us listen to him today and allow the people to exercise for themselves a yes or no vote on this. And if this were to fail, I would be gravely disappointed, but I also may understand it, because there was something on the ballot recently, just a few years ago. It was something called Colorado Care. And it went to the voters of the people of Colorado, and unfortunately it failed with 79% of Coloradans. Actually, it was 78.8%. I want to be accurate. Said, no, we do not want that for ourselves. We do not want that for our parents. We do not want that for our children and our grandchildren. So let this bill go through, let it work its way through, get all the amendments you need on it to make it something acceptable to the people of Colorado. Send it to them and ask them yes or no. Do you want this for your kids, your grandkids, and your parents?
Representative Gray.
Thank you very much, Madam Chair. There's a few things I'm not down here to do right now. I'm not down here right now to say good night to my children whose bedtime is 8 o'clock. I'm not here to speak to how much I love them and how much I wish I was with them right now. And also, I think this is a perfectly acceptable suggestion, but I would ask for a no vote. Thank you.
Representative Pelton, did you? No? Representative Van Winkle.
Thank you, Madam Chair, and thank you for that, Representative Gray. Your help is always appreciated. And if you haven't met Representative Gray's wonderful son, he is wonderful. He's very well behaved, and I appreciate him having the time in the well and his assistance.
Representative Pelton.
Thank you, Madam Chair. A bill with this sort of magnitude warrants the petition clause. I don't know why it wasn't on it to begin with. The timelines in this bill show that there's plenty of time to have a petition clause, and I think it's only fitting. You know, the citizens kind of gave us some direction a few years ago, and for us to go against that and not give them another chance is just wrong. So I rise in full support of this amendment. Let's take it to the people. They're the ones that are going to be benefiting or paying, however you look at it.
Representative Baisley.
Thank you, Madam Chair. So for folks listening in, and just for our own reminder, as if that were necessary, the safety clause that currently exists, that this amendment is proposed to replace, reads very quickly, very briefly, the General Assembly hereby finds, determines, and declares that this act is necessary for the immediate preservation of the public peace, health, or safety. That safety clause, we should be keeping in our back pocket for those items that we just got to get in place right away, because there is imminent danger. There's an imminent threat to the citizens, and we have got to fix some natural disaster, some traffic thing that we've realized that lives are being lost, that sort of thing. When we overuse safety clause, it becomes it loses the urgency that is intended in the safety clause. I don't think that this is a throwaway amendment proposal at all, and I really hope that that everyone here on the floor will consider this seriously. It's not a radical request coming from Representative Van Winkle. It's not over the top. In fact, it's putting this bill right where it ought to be. It makes it end where it ought to end, and having that kind of stately. All right, now we've said it. If the folks want to decide otherwise, the people, then they can. But there's not an urgency, as we know, for this because of the lengthy rollout. So anyway, please give this serious consideration. I don't think this is an amendment that ought to be thought of as a time waster at all. It's something that I think truly deserves our consideration, and I ask you to vote yes on this. It's the right thing.
Representative Ransom.
Thank you, Madam Chair. Just because an amendment is proposed by the minority doesn't mean it shouldn't just be, that it should just be thrown off and voted no on. I did that with the preposition. But I rise in support of this amendment. When we call the petition clause, when we talk to our drafters to add a petition clause, we're allowing the voters to have a say in what we're doing here. That is something that we have committed to do when we run for office. We don't come down here to be rulers. We come down here to serve our districts. And as I said a few minutes ago, we are accountable to our districts. We should remain accountable to our districts. And we should serve like we respect the people in our districts enough to trust what they want us to do. We should not be afraid of being accountable to the people of Colorado. As we heard during a few of my colleagues that have been speaking in support of this amendment, I do understand that there was an election 4 or 5 years ago in which a single-payer system was soundly defeated by the people of Colorado. That being said, this bill is not that same proposal. This is a different bill with different ideas and different proposals being brought forth. So I don't think we're asking or saying that this would automatically have 79% of Coloradans opposed to it. All that being said, they should have the opportunity to weigh in on what we're doing here. Even the fact that we call it a safety clause, it's standard for some people to always put safety clauses on their bills because this, every single bill is necessary for the immediate preservation of public peace, health, or safety. Is that true? Is that real? Some bills are. We absolutely have some bills going through our system from time to time that the General Assembly hereby finds, determines, and declares that this act is necessary for the immediate preservation of the public peace, health, or safety. This provision that is on the current version of the bill that we are dealing with at this moment does not allow the people of Colorado to come in and have a say, because we are saying that the provisions in this are necessary for the immediate preservation of public peace, health, or safety. Okay, folks, this bill will be rolling out over the next several years. There's really nothing immediate about it. Yet, the wording of this clause, and again, I'm not even sure that I agree that it should be called a safety clause, because what is it doing for safety, at least in this bill? It's not immediate. These provisions will be happening over the next several years, yet we're saying that it's necessary for the immediate preservation of public peace, health, or safety. It is illogical at best to have this clause at the end of this bill. Letting it go into effect over the next couple of months is very reasonable. It actually is responsive to the people that sent us here, and it actually is more in line with what the bill is actually doing. Does the General Assembly hereby find, determine, and declare that this act is necessary for the immediate preservation of the public peace, health, or safety? I would respond, no, it does not and it should not. And I strongly urge an aye vote on this good amendment. Thank you to the representative that brought it.
Representative Roberts.
Thank you, Madam Chair, and thank you, Representative Van Winkle. And I do appreciate everything that's been said by my colleagues. I've run bills with a lot of you. I genuinely think about the petition clause on every bill that I do, and I only put a safety clause on if it's necessary. And those of you that have run bills with me know that. The reason why there's a safety clause on this bill is because we need public input on the standardized plan design. This bill seeks out the public's input on creating that plan, and because insurance rates are filed almost a year before they go into effect, the insurance carriers, and I mentioned the Colorado Association of Health Plans are not opposed to this bill. They needed this to start happening as soon as possible. So this was actually needed by the health insurance plans that this rulemaking process of the standardized plan where we'll get public input starts as soon as possible. So I appreciate everything you said, but respectfully ask for a no vote on this amendment.
Representative Van Winkle.
Thank you, Madam Chair. And members, this bill grants unprecedented power to an unelected government bureaucrat, the commissioner, and we tried to get that position elected by the people of Colorado, and we failed, and perhaps rightfully so, because it was not the wishes of the bill sponsors. But I think in this case, the people of Colorado can decide for themselves what kind of future they want, what kind of health care they want, whether they like their health care. If they don't like their current health care and they see this as if this is a visionary process for the future that they can see participating, that they can see liking, then let them vote on that. Let them say yes and buy into this. Because, look, the healthcare system is complex, but the people of Colorado are also not stupid. And they can decide for themselves, and a simple election is nothing to be afraid of. It's nothing to fear. It's nothing to run from. And this bill is nothing to hide on a late Thursday night when perhaps people are watching something like the Colorado Avalanche as opposed to the wonderful Colorado channel. I ask for a yes vote on this. Let the people decide.
Representative Hanks.
Thank you, Madam Chair. Yeah, I support Amendment L106 as well. I'm not a gambling man, and I feel like what we are doing is gambling with the health options of all Coloradans, but certainly rural Coloradans. We do not know how many doctors are going to quit. We've heard a lot of letters, read a lot of letters, heard from a lot of constituents that are medical professionals that say they might seek greener pastures in Colorado. I don't think we should take that gamble without the people being able to vote on it, talk about it with their own hospitals, their own county officials, with their neighbors. And this amendment would allow that to happen. I appreciated hearing the words of Thomas Jefferson. I think it's always good to have a few perspective comments in here, and certainly Jefferson was as eloquent as any. I think of Franklin Roosevelt, who wanted to be known as the great experimenter, and I don't think that's our role. Of course, FDR got away with it because he was a wartime president and there was a lot of additional things going on. But I don't think we're in that situation where we ought to be great experimenters with the health care of Coloradans, both rural and metropolitan. So I rise in support of this amendment. Thank you.
Representative Carver.
Thank you, Madam Chair. Well, of course, the Colorado Constitution was amended in the early 1900s to specifically direct the legislature that the standard provision that should be put in our bills is the petition clause, a safety clause only to be used where there was either a fiscal impact that needed to line up with a budget timing decision or for immediate public health and safety. And so this amendment was added to the Colorado Constitution at the same time as the referendum amendment, whereby the citizens could gather signatures and put an item on the ballot. The petition clause being another route added at roughly the same time during the populist era that was sweeping Colorado and the country at that time in our history. And so the whole purpose of the petition clause, which again is to be the standard, reflects a philosophy that the citizens should have oversight of what the legislature does and a period of time before that bill goes into effect, that if they disagree with what we've done, they have a period of time to gather enough signatures, put it on the ballot, and by doing so, suspend that bill from going into effect until such time as the voters make the decision. I think the citizens of Colorado were wise to add those provisions to our Colorado Constitution. We should honor the spirit and principle and take out the safety clause, and instead, since there is no immediate safety concern that is in issue on this bill, and adopt this amendment to instead add the petition clause. Wouldn't it be interesting, my fellow legislators, to have that discussion, knocking on doors one by one and asking our fellow citizens if they support legislation that would mandate doctors participate in health plans and the government would set the prices? What an interesting discussion that would be on the doorsteps of our fellow Coloradans. I ask for a yes vote.
Representative Pico.
Thank you, Madam Chair. I rise in very strong support of this amendment. The safety clause is grossly overused. It should really only be used on those limited occasions where there really is an immediate impact. Heard not too long ago, someone said it was a good amendment, but vote no. That makes no sense at all. So let me ask you all, what are you afraid of? Ask for an aye vote.
Representative Luck.
Thank you, Madam Chair. If you all recall, during his State of the State address, Governor Polis told us that his objective over the next 2 years was to fundamentally transform Colorado. Many of my constituents see this particular bill as in that vein, as an effort to fundamentally transform Colorado. And a number of my constituents don't want to fundamentally transform Colorado. They like it just the way that it is and has been for a number of years. Therefore, I rise in support of this particular amendment, for if we are going to fundamentally transform Colorado, whether all at once or piece by piece, the people who live here should be able to speak into that process with more than just the 65 of us in this chamber or the 35 of those in the Senate chamber. They should be able to speak into it on the ballot, and we should not be afraid of hearing what they have to say. Thank you.
Representative Williams.
Thank you, Madam Chair. Members, as you know, I don't normally come down on second reading.
Is that right?
But I thought it was important enough to come down. You know what really gets me out of bed in the morning? Petition clause, especially when we're trying to strip off a safety clause. Now, for those of you who don't know, my House District 15, has a proud history of supporting the petition clause. From Bill Cadman to Doug Bruce to Mark Waller, Gordon Klingenschmidt, and to now yours truly. We support the right of the people to weigh in on this legislation or any legislation whenever they want to. So members, help me out. Let's support that proud history and let's vote for this amendment here. Thank you.
Any further discussion on L106? Seeing none, the question before us is the adoption of L106. All those in favor? A division has been called. The question is the adoption of L106. A division has been requested. All those in the chamber not entitled to vote, please be seated. All those in favor of L106, please stand or raise your hand and remain standing in one place until the count is taken. You may be seated. All those opposed, please stand or raise your hand and remain standing in one place until the count is taken.
Can't vote twice, Robert.
I thought, where's the election integrity?
He's just so tall. He's so tall when he's sitting, he looks like he's standing.
Flip-flop. Flip-flop, I can't figure it. A little bit of yes, a little bit of no.
You may be seated. L106 is lost. To the committee report. Representative Bradfield.
Thank you, Madam Chair. I'd like to bring in another amendment. I'm sure that this one is one that the entire assembly here will find useful and will, will find useful and is certainly acceptable to all in this building, in this room. I ask that Amendment L073, and I move this amendment be displayed.
L73 has been moved and displayed. Please proceed, Rep. Bradfield.
Thank you. Appreciate it. This is an amendment that asks the Commissioner of Insurance to make sure that he's hearing from the constituents that will be using this new medical program, and that he will set up a telephone number and or an internet website that individuals may access and to give their opinions for this pertinent program. And then it requires that once a year he report on the calls that have been made, and that also that there will be no adverse effects toward any person who calls in, whether their call is positive or negative. It's very simple, straightforward. Many businesses have such, and as such, I urge a yes vote on this amendment.
Representative Sandridge.
Thank you, Madam Chair, and I stand in strong support of this amendment. We're going into uncharted territories with this bill, and there's still some discrepancies of how this is going to impact certain counties and certain families in our state. So we need a easy means of communication to have input, to collect data, to know how this new law is impacting certain people. And that's what this amendment does. It offers phone capabilities and I guess internet and email capabilities there can be data collected in how this is going. And what this does is it gets firm opinions and actions from boots on the ground, from the people, our community, who's actually impacted by this. And what I like too about this amendment is there's a stipulation there that there shouldn't be any negative consequences for the people who calling in, because maybe the people calling in may not be the happiest, or they could be happy too. But what we need to know is we need to know how to maneuver and react to something that's new, and this is new. So let's have a great means of communication for our constituents to contact the government and tell them what they're seeing, if the prices are going up or going down, if access is decreasing or getting better. And this should be something that the people in support of this bill should love, because if you love the bill, then you're going to get a lot of great calls from our constituents saying they love it. Who does not like great calls saying they love what you're doing? If you love this bill, you're gonna get a lot of great calls in. If you think it's going to help people, you're going to get a lot of calls and a lot of emails saying, hey, this is helping me. It's a great thing. Thank you. So, and they could say, hey, this is kind of, expensive, and it's getting a little expensive, and it's not really what you promised me. So, we all discuss clarity. We all discuss transparency. Well, this is something we've all promised our constituents. Let's give them what we promised. Let's give them an easy access, easy number, easy email, easy website where they can express their concerns. Nothing that we should be afraid of. We should never be afraid of the truth. I ask for an aye vote. Thank you.
Representative Roberts.
Thank you, Madam Chair, and thank you, Representative Bradfield, for bringing this amendment. I agree that this should exist. It already does exist. I just pulled up on my computer, and I can't bring up props here because I didn't get approval from the majority leader, but DOI has 2 phone numbers, an email, and a complaint form that you can fill out and submit online. HCPF has 5 phone numbers, a fax, email, a complaint form. So this already exists. I think it's a good thing to have, but it already exists, so I think this is duplicative. I'd ask for a no vote.
Representative Rich.
Thank you, Madam Chair. Do you know how many times you can call one of those state agencies you just listed and they don't answer their phone? You should try that. I ask for an aye vote.
Any further discussion on L073? Seeing none, the question before us is the adoption of L073. All those in favor say aye. Aye. All those opposed, no. The noes have it. L073 is lost. To the committee report. Representative Geithner.
Thank you, Representative Sirota. And so, members, we've had a pretty robust conversation so far, and I think a lot of the amendments that we have moved have each in their own right had an impact that would make the Insurance Committee report better. But I think this is probably one of the more important ones. And so with that, I move L100 to the committee report and ask that it be displayed.
L100 has been moved and displayed. Please proceed, Assistant Minority Leader.
Thank you, Madam Chair. And so, members, what L100 does is it's actually a non-severability. And that really means that what it recognizes is the importance of the committee report, correct? In the sense that if one piece is changed, well, there's a change across. This actually helps to identify the importance and the level of importance that that I think is trying to be expressed in the committee report and 1232. And so with that, I would urge a yes vote on L100.
Minority Leader McKean.
Thank you. Thank you, Madam Chair. It is an honor to serve with you.
And you.
When I started some of my comments, I complimented the sponsors on just how difficult a problem this is. In fact, I suggested that maybe this is too complicated of a problem for government to solve. And one of the things that I mentioned was that the challenge, the great challenge about getting this right is it's kind of like a string puzzle where you pull on one and it affects all the others, and you pull on another and it affects the other two, and every time you pull on one, it affects the rest. And what you heard from the sponsors was agreement to that. This is a difficult problem because if you change one piece of this, it affects all of the other pieces. Well, this is your lucky day, because this amendment says that they're all interconnected. This amendment says you cannot sever one part of this act without it affecting the rest, because that's the reality, that's the truth. The truth is you cannot do one thing in consideration of doctors, or one thing in consideration of health plans, or one thing in consideration of hospitals without it affecting not just the rest, but viscerally affecting the rest. And so that means that you can't have what is in this bill, which is a severability clause, which says, it doesn't matter what happens to the docs, we'll just hang on to this over here. You have interconnected pieces. When you have interconnected pieces like that, you need to have an amendment like this, because this amendment says they all have to work together. So I urge an aye vote for this amendment, because what we're talking about is a system where each piece is dependent on the other piece. And that means that this is more important than ever. This is more important than almost anything else we talk about because the interrelationship between these things is so complex and so dependent. And the great thing is when the sponsors said, yes, this is complicated because these things are all interrelated, what it really did was say we need something like this. We need to have an amendment so it's non-severable, so that you know that these things all depend on each other. What it really does is it makes sure that they operate at their best according to what the sponsors say, which is, here are the numbers, here are the things you've got to do. Here is the plan to make this work. And what it really says is that if you remove any one of those pieces, it doesn't work like we intended. I urge an aye vote.
Representative Gray.
Thank you, Madam Chair. I am a municipal bond lawyer. I will not be as boring as I possibly could be, but trust me, I could be really boring if you wanted me to. Severability is a basic fundamental principle of legal contracts and statutes that we pass. The goal of this, I won't speak to anybody's motivations. The net consequences of this would be if people filed 17 different lawsuits against this provision and one of them succeeded, where there was a small portion of this. It would also take out all the other portions that were validly adopted by this General Assembly. Severability, what it means is if there's one thing that's wrong across an entire piece of policymaking, if there's one thing that's wrong, it doesn't mean that all the rest of it goes away if it was validly adopted by the duly elected members of this General Assembly, or adopted by the people in an initiative, or adopted in a contract by folks who are a part of that. It's a fundamentally accepted part of legality. And to my knowledge, we haven't done this one before. Like, we've done the petition clause a lot of times before. To my knowledge, we haven't done this one before, but I just want to say, to the extent we're doing this before, the goal here is to create a situation where if somebody sued and could nullify even the smallest part of something, the whole thing would go away even though it was approved by the duly elected members of this body. And that's not how we treat anything. In statute already right now, there is a for every bill that anybody runs, either side of the aisle, there is an assumption of severability for my bill, for your bill, for everybody else's bill. And the idea of doing this is I've never seen it before, but the idea is just to try to weaken the entire thing and go against the statutory presumption that has existed in our state for a good number of years. And for that reason, I would ask for a no vote.
Minority Leader McKean.
Thank you, Madam Chair. I'm not a lawyer. And if you ever spent time in judiciary, I would just say that over and over and over again. Not a lawyer. And so part of what this means is exactly what you just heard, which is exactly why I think it's so important that as a part of this contract to say that all of these pieces connected together the way they are what make this work, then I actually think that's what makes non-severability so important. Because if you remove one piece, you now have something that can harm the people of Colorado. You have something that no longer has a balancing point to it. I remember as a kid, we were trying to change a hydraulic pump in a John Deere 4020 tractor. And if any of you don't know this, which you wouldn't know it because you haven't done it, but the hydraulic pump is up above the steering bracket. And it's about a 400 pound piece of cast metal that has the tires attached to it. And it was my great lesson in balance, because my dad stuck a fence bar through there and he told my brother to grab one end and me to grab the other. So I grabbed the other and we walked that heavy, heavy thing away from the tractor, balancing it just perfectly until one of the tires hit a rock and we lost the balance. And that thing rolled down the hill about 300 yards down from the barn, and the tractor was there. We couldn't go get it back. We don't want that to happen to something that we put into statute. We don't want balance to be lost. This ensures that if balance is lost, then it doesn't remain to have the other unbalanced pieces harm the people of Colorado. When we talk about this kind of balance, we want to reduce harm. This maintains balance and makes sure that the sponsor's intent is preserved so that all of those pieces that push and pull against each other remain in tension exactly the way they are.
Assistant Minority Leader Geithner.
Thank you, Madam Chair. And so, members, I just wanted to, since I moved the amendment, it's not, the purpose of L100 is certainly not to weaken the policy that we are debating. I think that Minority Leader McKean hit a good point. And that is that where there is tension, where there is a shift in one side, naturally it will cause something in the other. That's the idea. If the policy is written in a capacity, then it should remain true. It should remain whole across the entire piece of it. So it's in no way is L100 to weaken the policy, and so I would reject that idea. Certainly, L100 does preserve, I think, the amendment in its whole form, and that's the idea of what 100 does. It is not there to weaken the peace policy. That's the purpose of it. So I would urge a yes vote on L100.
Representative Rich.
Thank you, Madam Chair, and I rise in support of L100. I think this is really a good idea because there's nothing to fear here. If this bill is what you think it is, then you have nothing to worry about with any lawsuit even coming. So, but it protects us. So, I'm asking for an aye vote on L100 and hope that you will consider supporting it.
Assistant Minority Leader Geithner.
Thank you, Madam Chair, and I just wanted to, thank Representative Rich for coming up and speaking on behalf of L100. I think that the idea of what we can accomplish with L100 is certainly that we can keep the entire piece of policy together because I think that's the idea. And so I would just urge a yes vote on L100 as we continue this debate.
Representative Soper.
Thank you, Madam Chair, and it's an honor to serve with you.
And you.
So I rise in support of this amendment to the committee report. Having a non-severability clause that says that if a provision is struck down in this section 13 or part 13, then the entire part would also fail with it. What we do here, members, is the acts of the General Assembly of Colorado are presumed constitutional. That's a legal interpretation that's been held true for several thousand years as organized governments have existed. It is really important that all elements of bills that we're moving through the legislative process are in fact constitutional. We've taken our oaths, we've studied the statute books, we've studied the Constitution. We are presumed to be the people's experts on the law of Colorado and that of the United States. Section 5 within Part 13 talks about fines and penalties and being able to compel physicians to be part of taking a standardized health plan. There's some troubling elements with this remaining in the bill and why it's important to have a non-severability clause. Licensed providers do enjoy a constitutional protection of the right to conduct business. The right to carry on a legitimate business is a property right, and it cannot be taken away or bridged by an exercise of the state's police power, unless it appears first that the interests of the public generally, as distinguished from those of a particular class, require such interference. So it would be up to us to decide whether this particular class of doctors requires such interference that we're going to deny them a legitimate business property right. And second, that means that the means are reasonably necessary for the accomplishment of the purpose and are not unduly oppressive on those individuals. This is from Olin Matheson Chemical Corporation, which was quoting Loughton against Steele. which was a U.S. Supreme Court case. This was interpreted by our own Colorado Supreme Court. In applying this analysis, we then would have to determine, by compelling our physicians here in Colorado to participate and associate, using the police powers, whether it's necessary to implement the standardized healthcare plan. Reasonable minds, I believe, would argue it's not necessary because currently physicians do take government health plans. Our physicians do take Medicare and Medicaid, for example. So to compel a physician under the fear and penalty of the police arm of the state certainly would go against whether it's necessary for this purpose, because we already know that physicians are already accepting government health plans. So the standardized plan would be treated no differently, we could assume. So then we turn to the next level of analysis on constitutionality, which is freedom of association. So the freedom of association is guaranteed under the United States and the Colorado Constitution, that licenses cannot be compelled by the state to enter into associations against their will. So to require a physician to be part of an association of standardized health plans would most assuredly go against their will if they did not want to participate. The First Amendment of the United States Constitution guarantees freedom of expression. It includes freedom of association and guarantees that the right to associate or refuse to associate with whomever one chooses. I'm going to be quoting a Brandon here, 1994 Colorado Court of Appeals decision. Under Colorado statutory law, the Division of Professions and Occupations within the Department of Regulatory Agencies regulates licenses for healthcare professionals. More specifically, the Colorado Medical Board regulates physicians. The enabling statute for the regulation of physicians by both the division and the board is the Medical Practice Act, which is found at 12-240-101. And the Medical Practice Act, MPA, is based on the state's police power interest in protecting the citizens of the state of Colorado from harm caused by unqualified licenses. So we've already invoked our police power to be able to license this profession because it is in the interest of the state to ensure that we do not have physicians operating in the state of Colorado who would cause harm to people unknowingly, and that we've created a standard by which they have to operate by. Every statute providing for the licensing of those engaged in a learned profession contains or can provide procedures for suspension or revocation of a license held by one who actually is found to be unfit or unworthy to continue to practice. This is a sufficient protection to the public and affords ample opportunity for a reasonable exercise of the police power in the public interest. The Medical Practice Act does not and constitutionally cannot prescribe a physician's failure to participate in a health benefit plan as grounds for any action by either the board or the division against a licensee, because it has nothing to do with protecting the citizens of the state from unqualified licensees. The Medical Practice Act also specifically describes the circumstances for when action can be taken by the board or the division against a licensee, namely for violation of the act. The Medical Practice Act requires due process and limits the action taken by the division or the board to include revocation, suspension, admonishment, etc. The Medical Practice Act does not and cannot authorize the imposition of fines against licensees for failing to participate in a health benefit plan. So as you can see in Section 5 of Part 13, there are fines for not participating in a standardized health benefit plan. So to have a non-severability clause would mean that when the court's looking at this, the court should be able to interpret this and say that this is unconstitutional, and because this seems to be a powerful element within the entire Part 13, that the entire Part 13 must go along with it. And that's what we're asking for here. It's okay, Representative Gray. I do appreciate the excitement to rebut a good debate. So it's the compelling of physicians to participate in the standardized health plan, which goes against the United States and the Colorado Constitution's right of association and the right to refuse to associate. You can choose freely who you want to associate with and who you do not want to associate with, and who you want to contract with and who you do not want to contract with. And under the it's the police power of the state that would compel this. And because it appears to be such a key element of this entire committee report, that we want to make sure that if this is what we're basing everything on, that the act should rise or fall based on this provision. And members, I would ask for a yes vote. Thank you.
Representative Gray.
Thank you, Madam Chair, and members. I promise I won't do this every time if we do this again, but this amendment does not have anything to do with the healthcare system. It doesn't have anything to do with this piece of legislation. It has to do with trying to impair the ability of any piece of legislation that somebody does not want to move forward to try to weaken it. Colorado Revised Statute Section 24204 is the exact opposite of this. So I've got the book here from the back. I'll hand it to anybody who wants it. Anybody who wants to come and look. 24204 creates a presumption of severability for statutory provisions in the state of Colorado. If you want to know when that section was adopted, it was 1963. So we're sitting on a good solid half century of this being the law. The idea of this is to try to create, if you can find any single weakness anywhere in a piece of legislation, you can get rid of the entire piece of the legislation. And it has been the public policy of this state for decades to not do that. And that doesn't just apply to this bill. This has nothing to do with healthcare policy. You don't see the word healthcare, it doesn't show up there at all. The idea is to say, we can poison pill other people's pieces of legislation, and it's not limited to one party or another party. The idea is if you can find a hair speck wrong, you lose the whole thing, even if the system can still work. And I have not worked on this bill. I don't sit on this committee, but that's the goal of it. And if that's what we're going to start trying to do to each other's bills, okay, but it's not limited to this bill. The word healthcare doesn't show up there. There's nothing about healthcare policy right there. The idea is give my lawyers a shot to find one thing wrong. If you have one foot foul, I can take out your whole piece of legislation, and it's been the policy of this state for 50 years that that's not what we do. When we have a piece of legislation, if there's something that somebody finds to be wrong, all right, we'll fix it. We'll give them a chance to do it again. But if this is what we're going to do now, this is what we're going to do. And next time I come down here, I'll just say, hey, refer to my speech when we talked about public option that day, because I don't want to waste your time on it. But that's not what this is. The word healthcare doesn't, this is not a healthcare amendment. It has nothing to do with healthcare. It has to do with the idea of, it gives lawyers like me a chance to try to find anything wrong with what you've done and to kill your whole piece of legislation because I don't like it, and it goes against the policy that we've had for decades. And I promise I'll just say ditto from now on because I know it's nerdy and nobody else cares, but we can try to drown the meaning of what we're doing right here. We can try to drown it under a bunch of legal language, but what this is this is a new option for what we can do to each other's bills in this chamber to try to say, if I can find anything wrong with it, I can kill the whole thing. And I don't think that anybody in this chamber deserves it, and nobody else has for the last 50 years. Thank you.
Representative Soper.
Thank you, Madam Chair. And Representative Gray, could I see the statutory citation? Yeah, and while you're looking for it, I do want to respond to that. in committee, we did talk about Section 5 of Part 13. And we raised the constitutional elements. And the response we heard back was, this is so important to the bill that we do not want to remove this element because of the fear that unless the state can compel participation, then the entire plan would fail. If that's true, put your money where your policy is. Because if we're basing it on the fact that, thank you, and I appreciate that. If that is true, that this is the key provision in law, but yet I was able to read elements that show under the Colorado and the state constitution, it's pretty darn clear this would not be constitutional. All we're doing is buying into a lawsuit. So either the lawyers on one side are right, then in that case, back this amendment, because let's go ahead and see whose constitutional lawyers are better. If not, let's strip Section 5 out. Because what we do here is presumed constitutional. And I do not believe we should start a policy of purposely putting in unconstitutional provisions into statute for the sole purpose of letting lawyers argue this out all the way up to the state or U.S. Supreme Court to have that struck out. I mean, talk about adding to the cost of health care. Those costs will be passed on. And Representative Gray, I once again appreciate seeing this, and I'll read it over with delight. Thank you.
Minority Leader McKean.
Madam Chair, thank you so much. You know, this is a very brief discussion that Representative Gray and I had on the side, and I actually appreciate not only his passion on this, but his concern, because we don't ever want to get into a position where we're just sniping at each other to make one thing or another and one thing or another be the crux of a bill or of an idea. This is not that. And to be honest, that's exactly why I think it's important that we have the debate and the discussion, because we can say this we're going to do because it's just to get rid of this bill. No, actually, the reason why this rises, the reason why this merits your inspection is because of a letter. And the letter says that there's a legal opinion that says it's not constitutional. And so I spent time talking about how all of these pieces are connected. And it really does mean that if one is not constitutional, then number one, we should have care about whatever part of a bill is something that we might put at risk in passing that does not meet the test of the law. And so when we put something like this in, it says that in such a bill, in such a situation where these pieces are dependent on each other and one piece is not constitutional, then the others cannot stand. This is not calculus. If you want calculus, come to my office. It's a clock on the wall. You know the answers. But what I will tell you is it's not complicated. It's not difficult, because what we're really saying is this is an important interrelationship to make any of this affordable. And we heard in committee that the only reason this can work is to compel participation to make the network big enough, because that's what it's going to take. But if you are not able constitutionally to compel, as one opinion we have says, then it's not fodder for any lawyer. It's the need for us to derive an answer. And what this does is it says, then hold us accountable. Then if this is unconstitutional, because this is one opinion, I think there are probably other lawyers around who might have other opinions. And we get large nods from the back. But here's the thing, then what's the risk? Because the true risk here is so little. It says, you know what, then if it's not, then it should be fine and the interrelated pieces can stand. If, however, it means that this part is not constitutional and therefore the underpinning of the whole thing falls away, then it should. Again, I urge an aye vote.
Representative Hanks.
Thank you, Madam Chair. I rise in support of this amendment L100. I'm not a lawyer. I'm a citizen legislator. I also consider myself a political climate forecaster, that I bring information from my district. And I've been talking to some of my constituents who have been watching this. I guess the Avalanche game is blacked out or something, but they made the comment in the group here that we don't even, at this point, the citizens of Colorado from my district, don't even fully know what we are discussing. And I'm kind of wondering if we're in that same boat here, whether we care to admit it or not. But a couple of lines from my constituent, and if this is the forecast of what we're seeing, I think we have a problem with this bill. I don't know if this amendment's going to help, but the comment was, "What a horrifyingly convoluted gob. It should get trashed." Maybe that's not helpful, but that is what I'm hearing. I urge a yes vote on this amendment. Thank you.
Minority Leader McKean.
Thank you, thank you. My words would not be so pejorative. I think this question comes up, and I think that we struggle with it because it's important. And I think it's important because we're actually at the crux of some things in this, truly the second committee, to sit here and really put it up to say this is not a plaything. This is a responsibility that we have. The responsibility being that we comport with all the elements that we are discussing. And I really appreciate the fact that we started off with some debate, and I appreciate the fact that I could have a very civil conversation over here on the side with Representative Gray, because I think that those are the things where we see what that touch point is about what the problem is. I give you my word, I am not here to introduce a poison pill. I'm here to say this is an important amendment if part of this bill is not constitutional and they're all dependent on each other. So when you suggest that we would offer poison pills, then it would be, well, we're just sort of playing around with the notion of what we do with legislation. This is actually incredibly important to me, because as you've heard me sometimes raise my voice down here, but not a lot, I don't like bad policy. I don't like bad legislation, because either we have to clean it up, and that's why I love being on statutory revision for a long period of time, or we have to live with it until somebody else comes along and says, this was not right, this is not the way we should do this. So it is an important question. I appreciate the debate. I appreciate the words from my colleagues, because they're very important. I take that responsibility very seriously. So again, I urge an aye vote for this. This is not just a passing debate. This is a debate about how we treat a piece of legislation that has in it some concerns.
Representative Carver.
Thank you, Madam Chair. And this is a question for the bill sponsor, since this amendment and the discussion has involved issues of constitutionality. And I appreciate the diligence of the bill sponsors in thinking this through. Could you provide a citation to the Colorado Constitution that you believe gives the state the authority to compel physicians to participate in the regime as specified in House Bill 21-1232?
Well, Rep. Roberts, you can respond to that, but I'm not sure that that actually is specific to this non-severability amendment that we are discussing. Representative Carver.
Thank you, Madam Chair. And I believe, given the discussion that we've had about the constitutionality issues that have been raised as part of the discussion on the amendment, and how the non-severability of how all of this fits together, but referencing specifically the discussion that Representative Soper had on this, I think the fundamental constitutionality of requiring the physicians to participate and how it relates to severability and non-severability is absolutely core to our discussion on this amendment. And so if the bill sponsor is able to provide some clarity, some citation to a provision in the Colorado Constitution that he believes provides this body with that authority, I think that that would be helpful as part of this discussion.
Representative Roberts.
Thank you, Madam Chair. I don't think the question fits under the amendment, but I'm willing to have this discussion with my colleague and someone I respect, Representative Carver. Yeah, the citation is Colorado Society of Community and Institutional Psychologists Incorporated versus Lamb, which is at 741 P. 2nd, 707. It's a Colorado Supreme Court from 1987. It essentially says that the General Assembly has the ability to fashion a licensing scheme that protects the public health, safety, welfare, and morals of the people of the state of Colorado. So I can write down that citation for you, but happy to have that discussion.
Any further discussion on L100? Seeing none, the question before us is the adoption of L100. All those in favor say aye. Aye. All those opposed, no. No. The noes have it. L100 is lost. Representative Caraveo.
Thank you, Madam Chair. I will say that I really appreciate all the discussion that's gone on about the importance of doctors in the healthcare system with this bill. It is a conversation that I've been having for weeks with the sponsors, and they have very graciously made me part of a lot of discussions and included me in a lot of the decisions that they have made. And so while I know that the different groups of doctors continue to have some concerns with the bill, I think that it is important that we increase our voice in the process of the Colorado option as it becomes established. And so I would like to offer the first of a few amendments that I've worked with the sponsors on in order to make sure that that voice is heard. So with that, I offer L87 to start. And I move Amendment 87 and ask that it be displayed.
L87 has been moved and properly displayed. Please proceed, Rep. Caraveo.
Thank you, Madam Chair. So what this amendment will do is that it will ensure that not just a provider, but specifically a doctor is part of the advisory committee. This group will oversee some of the changes that come to the healthcare field as we try to reduce costs for patients and ensure that that we have a seat at the table to make sure that the effects on doctors and our ability to care for patients are not are not undue, and that we are able to continue to provide good care for our patients. I ask for an aye vote.
Minority Leader McKean.
Thank you, Madam Chair. Thank you for this amendment. It's important. I mean, you hear a lot of the discussion is how do we get more of the voices in the room that are part of the care process and the system, so that we know that what we're looking at has that kind of eye behind it. And in committee, I may have grilled Commissioner Conway just a little bit, but it's when I see someone who's in a bureaucratic position and so much power that on an advisory commission like this, I want to see that. So thank you, and I urge an aye vote on this amendment.
Any further? Representative Soper.
Well, thank you, Madam Chair, and I also rise in support of this amendment. This is a great amendment. The fact that a healthcare provider in the form of a physician was not part of the advisory committee was probably a oversight. And so the ability to have this in here definitely brings that full spectrum as we're talking the advising on a standardized health plan, that if we don't have doctors involved, we're missing that key voice that's able to talk about what they're seeing on the front lines. Because doctors really do know what's going on. I can tell you from having had many conversations with doctors at our hospital, that they tell me all sorts of stories about interacting with health insurance companies and the frustration they've had in being able to do something for a patient because perhaps the reimbursement was turned down, or the specialist they wanted to refer them to was out of network. And they really did know a lot about what was going on in the health insurance world with their patients. So to be able to have them as part of the advisory board is a very clear nexus to what's being done here. And I rise in strong support and thank Representative Dr. Caraveo for bringing this amendment. Thank you.
Representative D. Valdez.
Thank you, Madam Chair. Members, I rise here because in recent research from the University of Colorado says that the medical workforce is facing a crisis level, shortages in primary care doctors. The problem is particularly pronounced in rural areas, such as my district, in House District 62, which have a difficult time recruiting and retaining doctors to practice. And with that, I appreciate the amendment L008 and support L087. Let me get this right, L.087. Thank you very much.
Any further discussion on L87? Seeing none, the question before us is the adoption of L87. All those in favor say aye. Aye. All those opposed, no. The amendment is adopted. Representative Caraveo.
Thank you, Madam Chair. And so part of the discussions that I've had with the sponsors and with many of the advocates, and they agree with me on this point, is when doctors, while they are an important part of the provision of health care, are many times the smallest part of it. We're kind of outnumbered by the interests of health plans and hospitals. And so what part of my concern has been with this bill before speaking with the sponsors about this amendment is that this may have an effect on the workload for physicians. I'm concerned that they may eliminate positions, that they may be required to increase their workload, see more patients. For example, the first clinic that I worked at, I was required to see 30 patients a day, and I probably didn't provide the best care for my patients, whereas now I see somewhere between 15 and 20, and have really been able to tell that I can spend a lot more time with those families, a lot more time with those kids, and really kind of delve into what their healthcare issues are. And so we want to ensure that anything that happens with this bill, with this program, does not lead to that very same problem with the health physician workforce overall. So with that, I move Amendment L88 and ask that it be displayed.
Amendment L88 has been moved and properly displayed. Please proceed, Rep. Caraveo.
Thank you, Madam Chair. What this amendment will do is ensure that there is a study that will be required in the bill to evaluate the impact on provider workload and the size of provider panels, which is the number of patients that a provider has under their care, to make sure that there's not any negative impacts on either of those two things, and therefore impact on patient care. I ask for an aye vote.
Any further discussion on L88? Representative Soper.
Well, thank you, Madam Chair. I do have a question for the amendment sponsor. Is this purely just a study, because I haven't quite analyzed where this fits in, or is there an element where this does become a cap on the panel of patients, or that we get to a point where we're actually regulating how many patients, for example, a doctor in a clinic could see in a particular day, like if we're talking 30 or 25, because certainly depending on what that number is, it could be very, very difficult to have that doctor make ends meet. But by the same token, if you have complicated cases, it certainly would lead to the other way. So that's why having hard numbers, I certainly fear what that could actually lead to, because what you could see in a metropolitan area and what a physician could see in a rural area, just vastly differences based on the fact that you may have, vast differences based on the locations, just because you have far more patients in an urban area than a rural area, although that can also depend on the provider. So there's lots of variables, and I just want a little clarification.
Representative Caraveo.
Thank you, Madam Chair. Thank you, Representative Soper, for the question. I think the way that this ties into the advisory committee and the fact that it has a physician on it, that they're going to work jointly, and this information will go. It's funded by the current fiscal note. It will be made available to the public, and it will be made available to the advisory committee, so that that physician and other providers on the advisory committee can take into account the complexity of cases, the geography of the area that's being looked at, and ensure that the changes in whatever field, whatever specialty, whatever geographic area have not been detrimental to the practice of medicine in that area. So there's going to be a few different checkpoints, including that new advisor that new physician advisor on the committee to take all those variables into account.
Any further? Representative D. Valdez.
Thank you, Madam Chair, and it's an honor to serve with you.
And you?
Thank you. And if you look at Amendment L088, which is a good amendment because during this pandemic, you saw the workload of our health care overloaded from day one. Not only the care, but also the support and the need during this pandemic. And this is a good amendment for rural Colorado, and I support L088. Thank you.
Any further discussion on L88? Seeing none, the question before us is the adoption. Oh, Representative Pico.
Thank you, Madam Chair. This actually looks like a pretty good amendment, but frankly, it should have been done a long time ago, before you burn the whole system down. When you wipe out the workforce and force doctors out of the state, your workload is going to be pretty bad on those who are left over. So it may well be a good amendment, and I rise in support, but you ought to do that first.
Any further discussion on L88? Seeing none, the question before us is the adoption of L88. All those in favor say aye. Aye. All those opposed, no. The amendment is adopted. Representative Caraveo.
Thank you, Madam Chair. And hoping for 3 out of 3 here. I would, in pediatrics we always say, and I'm not going to do this, but good try, Representative McKean. In pediatrics we always say children are not little adults, and the adult medical system does not apply to children. And a very prime example of that is that in this bill we reference Medicare time and time again, but children aren't on Medicare. I don't take Medicare, I take Medicaid. And so it's very important to add a conversion, essentially converting Medicare rates to Medicaid rates, so that the children who are seen under the Colorado option, pediatricians can actually charge for their care. And so the bill right now is not really directed at children. I'm trying to make it a little friendlier to children. And so what this amendment, is going to do is add that conversion rate. So with that, I move L064 and ask that it be displayed.
Thank you. The amendment is properly before us. Please proceed.
And so I would really just once again like to thank the sponsors for being so open to the concerns that I've had as the doctor in the body, and really appreciate your ability to work with me on this, and therefore ask for an aye vote on this one as well.
Representative Pelton.
Thank you, Madam Chair. I have a question for the representative that brought this amendment. Medicaid is a lower reimbursement rate than Medicare, so does this make the reimbursement rate lower, having this conversion in there, or not? I need to understand.
Representative Caraveo.
Thank you, Madam Chair. Thank you, Representative Pelton. Nope, this is exactly what this amendment does, is it converts it, so it does a calculation to bring the Medicaid rate up to the Medicare rate.
Representative D. Valdez.
Thank you, Madam Chair. And members, I'm not a lawyer, but this is a good amendment for rural Colorado, and I want to thank a doctor. And I stand in strong support of this amendment.
Representative Pico.
Thank you, Madam Chair. This strikes me as this is going to be another pretty hefty fiscal note, impact to the state budget, funding Medicaid. Do we have any idea what that's going to run?
Representative Caraveo.
It will. Thank you, Madam Chair. Thank you, Representative Pico. What it does is it ensures that children can be part of the plan. So it's incorporated with the rest of the fiscal note and the impact on the state. What I want to ensure is that those children can actually get care, and so that's why I'm doing the conversion.
Representative Pico.
Thank you, Madam Chair, and thank you, Representative Dr. Caraveo. But that really didn't answer the question. What is going to be the impact, given that we have to fund Medicaid? What's that going to do to us?
Representative Roberts.
Thank you, Madam Chair. And first, my thanks to Representative Caraveo for her work on this amendment and the other amendments. I appreciate it. Representative Pico, this doesn't say that we use Medicaid dollars to pay these doctors. It says that because the whole entire bill, the private insurance companies use a Medicare referenced price, but it's a certain percentage above Medicare, that they'll do the same thing here. It just needed to be converted because pediatricians don't take Medicare clients, they take Medicaid clients. So it's still the private insurance company paying the provider. There's no funding going to Medicaid under this amendment. It just is about how we calculate what the rate is.
Representative Pico.
Thank you, Madam Chair. Okay, I get it. That's a pretty clear and very important distinction. But yet still, you're jumping the rates then on everybody to pay these rates. That's going to reflect down on insurance rates. So how is that going to reduce insurance costs when you're dumping an extra load onto the insurance companies?
Is there any further discussion on Amendment L64? Seeing none, the question before us is Amendment L64. All those in favor, please say aye. Aye. All those against, no. No. The ayes have it. Amendment 64 is passed. To the committee report. Representative Will.
Thank you, Madam Chair. It's an honor to serve with you. So I didn't have the privilege of listening to this bill in committee, but I did get a lot of emails, a lot of phone calls from my constituents and my small rural hospitals. I heard from them a lot. I know a lot of them testified in committee, and we're pretty protective of our rural hospitals. And I even had some of them originally. I know the bill's been changed. So, and I appreciate that and thank the bill sponsors for that, because I'd heard from my hospitals that the way this was originally written, they'd be out of business in 3 years. So I'm glad they addressed some of those concerns and those in reimbursement rates. But I want to further protect some of our rural and frontier counties that without a critical access hospital. So I move Amendment L084. Ask it to be displayed.
The amendment is properly before us. Please proceed, Representative Will.
Thank you, Madam Chair. And what this does is it really adds some under definitions. It adds the definition of suburban counties, which means Douglas and Broomfield counties, and then another definition of urban counties, which means Adams, Arapahoe, Boulder, Denver, El Paso, and Jefferson counties. And then further in the amendment, the carrier reimbursement rates do not apply to a county that is not an urban or suburban county if such county does not have a critical access hospital operating within the county. And then furthermore, the subject to the reimbursement rates established in 1016-1306 of the bill. And this This amendment really helps, it truly helps Rep. Catlin's area down there, all the way south to the Durango. And then doesn't, I have 4 other hospitals, but the one there in Glenwood keeps me out of it. So this does help those rural, exempts those rural frontier counties that don't have the critical access hospitals. So, and it exempts rate setting for rural hospitals. So with that, I'd ask for an aye vote on this amendment.
Representative Catlin. Representative Roberts before Representative Catlin.
Thank you, Madam Chair. I have the utmost respect for Representative Will and Representative Catlin. This amendment would hurt your rural facilities. This strike below accounts for rural providers and pays them more than they're getting right now. If you exempted them in this way, they would not be able to take advantage of that privilege for rural Colorado. I don't think this amendment does what you think it does. This would harm rural providers and rural clinics. It would harm the providers in your district. It would harm the providers in Rep. Catlin's district. I ask for a no vote.
Representative Catlin.
Thank you, Madam Chair. It's an honor to serve with you.
You as well, sir.
Thank you. I haven't been down here much during the debate because I don't play a lawyer on TV, and some of this stuff was a little beyond me. But I do know that my community hospitals in Montrose and Cortez both are concerned. They're worried. You know, I've heard what the sponsors have said. I trust him. But I also worry about the people at home. You know, I hear that the big hospitals have negotiated themselves down to neutral. And that's a win for the sponsors. But it might be a loss for me and for the people that sent me. My rural hospitals feel like they're hanging out with no protection, that they're concerned where they're going to go. You know, people make a joke of, if you like your doctor, you can keep him. Well, our people like our hospital, and we need to keep them. You know, I don't know if any of you could think about what losing a hospital would do to a community. I would imagine that most of the equity in that community would have moved, because nobody's moving into a town that closed its hospitals, I can tell you. You know, when we started thinking about this bill, I was on that study bill. I went to a couple of the meetings, had to drive out of town to go get them, to be at the meeting. Not many of my folks were there. But one of the things I kept reminding the people that were doing the study is that none of the rural hospitals have a crane in the backyard or in the parking lot adding on to them, where all of these hospitals over here do have, or have had. Added wings, added floors, they've done everything else. That looks to me like business is pretty good. But in my district, they're hanging on. They're barely hanging on. 2% margins. Folks, we just came through a COVID that knocked them clear down to their knees. It's going to take some time to heal. I've been down here a number of times in the last 3 or 4 days talking about let's give it more time. The hospitals that I represent are in trouble. They're just now getting to the point where their operating rooms and those kind of things are starting to generate enough traffic that the hospital's beds are being occupied. The idea that we got to cut costs and those kind of things, and you know, I'm not sure if it's just the insurance company or them, but if the insurance company's not getting paid, they're not going to pay either. I've been down here and I've talked to you about how this state of Colorado keeps looking at people and saying you can get by with less water. You can get by with less gas. Well, I don't think we can get by with less doctrine. And what worries me is that we'll get to the point when we do these kind of things that we'll all have to do with less. I don't want to go there. I really don't. I'm concerned, folks. Rural Colorado is at a tipping point right now. Agriculture is having trouble, and all of us in rural Colorado are ag-based. There are families in my community that are not taking care of their health for a lot of reasons. But basically, it's not that they can't buy insurance, it's that they can't buy groceries. Vote yes on this amendment.
Representative Roberts?
Thank you, Madam Chair. I don't know how many times I can say it. It's in the bill. Protecting these rural hospitals has always been my priority in this bill. The Rural Health Alliance, that represents all of the clinics and hospitals in Representative Will's district, represents Delta, are neutral on this bill. They came to neutral before the Hospital Association, so I resent the implication that we cut a deal with the urban hospitals and left the rural hospitals out. It was the opposite. If you adopt this amendment, you remove the higher reimbursement rates that rural hospitals get. This is a bad amendment for rural hospitals. I ask for a no vote.
Representative Soper.
Merci. Thank you, Madam Chair. I also rise in support of this, and I do want to address the Western Healthcare Alliance piece. So in talking to leadership at Delta County Memorial, Community Hospital outside of Grand Junction, Colorado Canyons Hospital in Fruita, St. Mary's Hospital in Grand Junction, and I said to them, how much do you work with the Western Healthcare Alliance? Because it's my understanding that they have gone neutral, that they're supportive. The comment from the leadership of all those hospitals, and we're talking Central Western Colorado, Western Healthcare Alliance, Central Western Colorado, Delta and Mesa counties, they said they had never talked about taking a position on this bill. As a matter of fact, their participation was almost moot. Instead, they talked about how they worked with the Colorado Hospital Association, but not the Western Healthcare Alliance, even though, yes, they are members. They're definitely members, but in terms of their negotiation, I would put a giant asterisk next to that, because I would like to know who the leadership of the Western Healthcare Alliance was actually talking to in their membership group, because no vote was taken, at least not within Delta or Mesa County's hospitals. So we definitely don't know there. To be able to remove hospitals in counties that do not have a critical access hospital in rural and frontier counties is important, because as the map we showed you earlier, particularly when we talk about Delta and Mesa counties, when you start squeezing the area in which you can bill from, and I believe more people will choose the standardized health plan in that 25% that I talked about a few hours ago. So your pie's like this: 75% is from Medicaid or Medicare. That remaining 25% is commercial payers, and a tiny fragment is going to be your cash payers, out of pocket. That 25% will greatly shrink down as more individuals move to the standardized health plan. And you may ask, why do I think more will move there? Well, if it's in 3-4 years' time going to be 18% cheaper, simple economics says that you would naturally move there. So let's say that 4 out of 5 customers move over. So 20% of that remaining 25% are now part of this. Well, I'm actually going to argue that the reimbursement rates are still less, especially for a place like Delta, because I know in committee we had an exchange about kind of running the traps to see what the numbers are. We actually still get a better rate with commercial payers. We definitely don't have the same rate that's being proposed here, because there's a lot of questions about whether Some of these enhanced payments or plus-up payments are even going to apply to some of these rural hospitals like those in Delta and Montrose County. For example, under the plus-up number 6, efficiency in managing care and not overbilling patients. Well, this is a very, very subjective standard, because what it talks about is that a hospital that's efficient in managing the underlying costs of care as determined by the hospital's total margins, operating costs, and net patient revenue must receive up to a 40% point increase in its base reimbursement rate. Well, we're talking hospitals that have anywhere from a negative 4% margin to a 2% margin, and then to come in and say, well, just by looking at the total amount, you probably could argue that they are being efficient. But then as you start to dig through the hospital's budget and our audit that comes out every year, maybe someone over here in Denver is going to say, well, you could be a little bit more efficient over there, like you could change out your heating system, or you could have more efficient windows in your hospital, or perhaps you're paying a certain group of providers more than a similarly situated hospital, even though you kind of have to pay a little bit more in some parts of rural Colorado just to get certain providers in there to be able to provide a service that the community that's being served by that hospital has. It's altogether reasonable that you would not get this plus up, in which case you would not be hitting, for example, if we're adding all this up, the 200 to 214% reimbursement. Now all of a sudden you're being knocked back down, which means economically it's better for our non-critical access hospitals not to be included, because you're actually getting more money by staying out of the program. So this is why I'm in full support of this amendment, and why I will continue to push back, because we certainly have a lot of subjective terms included here, including essential access hospitals, which, by the way, only affects 3 hospitals, so that plus up would not be included for most of our non-critical access rural hospitals. As a matter of fact, the 3 that are included actually probably shouldn't be included, so this is really just kind of a specialized carve-out for some very profitable hospitals in western Colorado, or at least they should be profitable. So now we're back to critical access and non-critical access, or the equivalent, and that's still way less, I can tell you, than what we're being reimbursed by commercial payers. So this amendment is a great amendment, and I'm in full support. Thank you, Representative Will.
Representative Minority Leader McKean.
Thank you, Madam Chair. Madam Chair, we hear things and I tend to write them down or note them for a second, but what we're just hearing is, well, the rural hospitals are going to get higher rates, higher reimbursement rates. And so if that's true, where do these savings in rural Colorado come from? What's true is that the savings in rural Colorado come from cost shifting from Front Range Colorado. We've seen it before. It's an old tune. What we see is that, okay, we're going to pick the people that we know we need to protect because that's our passion, that's where we want it, and so we're going to shift that cost. And this is where we get to, folks. You can't have savings. This is where all of the pieces hinge on each other. You can't have that savings unless you get the money somewhere else.
Further discussion on this amendment. Representative Ransom.
Thank you, Madam Chair. When we're talking about rates and reimbursement, and to the rural hospitals especially, there was a formula that I was shown by one of the hospitals especially, and they were mentioning that there was the base reimbursement rate and then the formula that would add on for various areas, including the rural areas. And while I'm speaking in support of this amendment, I also want to point out that by starting at this base level, that's down 155% of a hospital's Medicare base rate, that is actually hurting all of the hospitals that are efficient, that are willing to take hard cases, and it's actually incentivizing the hospitals that are mediocre. And by adding on to the base formula for the hospitals that aren't meeting our arbitrary numbers that we're putting down. With that, the rural hospitals truly need to be able to get the money to stay in business, and driving them out of business is not to anybody's benefit at this time. I urge an aye vote on the amendment.
Any further discussion on this amendment? Seeing none, the motion before us is the passage of Amendment 84, L 84. All those in favor, please say aye. Aye. All those against, please say no. No. The noes have it. The amendment fails. To the committee report. Representative Rich.
Thank you, Madam Chairman. You know, under the current strike below, the term Commissioner of Insurance appears 52 times in 17 pages. The legislation creates an unchecked health care czar in the Commissioner of Insurance. For health plans, the Commissioner can dictate what products health plans sell, being standardized plans, which equal a public option, where we sell the health plans, every county where plans are on small group or individual markets, plus Commissioner can force plans into counties, what the prices of health plans will be via premium reduction targets, rate setting for hospitals and healthcare providers. For hospitals, the Commissioner of Insurance can dictate that they accept or participate in the public option, that they accept the public option's government's rate-setting pay cuts. For healthcare providers, the Commissioner of Insurance can dictate that they accept and participate in the public option, that they accept the public option's government rate-setting pay cuts. I offer Amendment L075. I move the amendment to the Health Insurance Committee report and ask that it be displayed.
The amendment is properly before us. Representative Rich.
Thank you, Madam Chair. This amendment says that the insurance commissioner must certify that there will be no cost shifts between the various plans. I think that's only fair that he must certify that, not just say may or maybe not. He must certify that there are no cost shifts between the various plans. I ask for an aye vote.
Further discussion on this amendment? The question before us, seeing none, the question before us is Amendment 75. All those in favor say aye. Aye. Opposed, no. No. The noes have it. The amendment fails. To the committee report. Representative Pico.
Thank you, Madam Chair. One of the things we keep hearing over and over again is the impact of the hospitals on taking this, and the providers. Providers and hospitals are going to be seriously impacted on this. And if this was actually a good bill, if this was a good deal, they'd be all for it, and they're not. I got an email today from an ophthalmologist in my district. Said all the same things we've heard from many others. They are going to be hurt by this bill. They're going to cut reimbursement rates. And I pay particular attention to the ophthalmologist. I might be his patient at the end of this session. But the hospitals, the providers, being required to take this with penalties if they don't, is probably one of the most serious things. The rural hospitals are barely hanging on. All the hospitals were hit hard during this pandemic when so-called optional or non-critical medical procedures were deferred. They lost vast amounts of money, and they're still trying to recover. What we see in here, the rural hospitals, we're going to plus up the rural hospitals. That's coming out of the urban and suburban hospitals. And we've heard some pretty striking terminology at times about high profit margins and profiteering. Almost half the hospitals in our county are nonprofit. There isn't any profiteering in a nonprofit hospital. So I think giving the option to hospitals to accept or not, to eliminate the requirement that they accept and eliminate the penalties is critical to keeping our hospitals afloat. And to that I move Amendment L099 and ask that it be displayed.
The amendment is properly before us. Please proceed.
Thank you, Madam Chair. This is very simple. It eliminates the requirement for hospitals and providers to accept this option and eliminates the penalties thereof. And it makes it possible for them to keep going. It gives them the option of not having costs shift to this urban or suburban from rurals. It gives the hospitals a chance to stay fiscally afloat. And I ask for an aye vote.
Any further discussion on this amendment? Seeing none, the question before us is Amendment L099. All those in favor, please say aye. Aye. Opposed, no? No! The noes have it. The amendment is lost. To the committee report, Minority Leader McKean.
Thank you, Madam Chair. It is an honor to serve in this august body with you.
Absolutely the same to you, sir.
Well, thank you. I have increasing concerns as we hear the discussion of rural and frontier hospitals. I have concerns that what we are truly doing is we are creating a system that we're not quite sure of, and then we are going to hold people as a mandate to accept the coverage that we have not yet created, and we're going to create things that hold them accountable to that. I think that's wrong. So I move Amendment L066 and ask that it be displayed. Give me one, you take those. You still have your copy? Yeah, thanks.
We can get our kicks with Amendment 66 as it is properly displayed. Please proceed.
Thank you, Madam Chair. I was kind of hoping somebody would do something with that. Thank you. Folks, what this does is it removes the penalties on healthcare providers and the hospitals. So what we have in this bill is we have a mandate that healthcare providers, your doctors, and hospitals, your hospitals, take this coverage and take this coverage at reimbursement rates that are far lower than what has become the norm of how doctors can pay their staff, pay their bills, and I don't know, sometimes even pay themselves. And so what this amendment would do is remove the hospitals and doctors from that mandate. It would mean that hospitals who might be fined $2.3 million over 90 days, which is about the billing cycle, to make sure that you're going to get the coverage and you're going to get the money back. 90 days, $2.3 million under this bill. I don't know if you guys have done the math on this, but for the first 30 days, you can be fined $10,000 a day. After 30 days, you can be fined $40,000 a day. That puts a lot of hospitals out of business because they don't have those kind of reserves. They don't have that kind of cash on hand to pay a fine for not taking something that they can't afford to take. $5,000 for physicians. $5,000 if a physician says, you know what, we just can't take that plan. Do you know that we do this with Medicaid today? If we have doctors out there who cannot afford to take Medicaid reimbursement rates, they can say, we're not going to see Medicaid patients. No more under this bill. No more under this bill. This bill says, you'll take what we give you or we'll fine you. This gets rid of that. I would urge an aye vote.
Representative Sandridge.
Thank you, Madam Chair. I stand in support of this amendment. I think the last thing a lot of these hospitals need is a fine, especially in the rural areas. A lot of them have struggled during COVID, just like a lot of families and businesses. This bill has the weight of regulation on it, and it definitely does not need the weight of these penalties, these financial penalties. Let's look deep into these penalties. If these hospitals get hit with these, somewhere they're going to have to cut a corner to pay these. So if you're barely making ends meet as a hospital and you have to pay these substantial fines, let's look at through basic economics. How's that going to happen? Is it going to happen through cutting corners of employees' pay? Is it going to be cutting corners on services? So I always thought that the essence of this bill was to help in the quality of care, increase the quality of care as well as prices. But having some type of financial penalty that can actually cash strap certain hospitals will be counterintuitive. So if we get these hospitals in a financial bind, this could directly affect a person's care. And so if I'm misunderstanding this, please let me know. Truthfully, I'd love to be wrong on my interpretation of this. So if I'm incorrect, just let me know. Thank you.
Representative McKean, Minority Leader.
Thank you, Madam Chair. You know, I mentioned this, and I think it deserves some fleshing out. I won't use his name. I won't use the clinic's name, but I got a call a couple years ago from a clinic in my city. It's my town. I don't call Loveland a city yet. Which Rep. Catlin's looking at me like, come on, boy. Here's the thing. One of the physicians that was a Medicaid physician in town who took Medicaid patients, he called me and he said, Rep. McKean, I don't quite know what to do with this. He said, we have a really big problem. We are about 9 months in arrears on Medicaid payments, and I'm paying my nurses, and I'm paying my rent, and I'm paying my insurance. He said, Hugh, I haven't paid myself in about a year. And my wife wonders how much longer we can go. Let me go back to that because he's a businessman. In fact, it's one of the things I love about the CU medical students who work in rural communities, because one of the very first things I tell them every year when I meet them is you're about to be a business person. You're about to own a business and have employees. You're about to have workman's comp and unemployment insurance and all the things you got to pay. But you're in medical school. You've been worried about aortas and pulmonaries and distal bicep tendons, which I know a little something about now. But you're about to be a business person. And what I was getting was a phone call from a man that I know who was saying, I am barely paying my bills, and part of it is because I haven't gotten reimbursements back from Medicaid. And do you want to know where his heart was in this? His heart said, I want to still keep being able to take Medicaid patients. Because guess what? He was the last clinic in town who was taking Medicaid patients. And he said, I want to make sure that I can keep taking Medicaid patients because these families are the families that need help the most and they need my services the most. So he was having to make a decision whether or not he would keep taking Medicaid patients, asking for my help to get his payment that was arrears. But he had a decision to make. Let that sink in for a minute. He had a decision to make. This bill does not allow that decision under this plan. It says if you don't take these patients under this plan, we will fine you. We will use the strong arm of government to tell you that even if this doesn't pay your bills, doesn't pay your rent, doesn't pay your nurses, doesn't manage to help you pay your insurance and everything else, we're still going to tell you you have to do this or you're going to get fined. That's not fair. That's not fair. If what we're coming to say is we want people to help each other and make sure that this network is adequate and that we can do all this, and yet it's a guy with a gun that's going to tell you you have to do this, that's not fair. This is an amendment that says, you know what, we don't need to do that to our doctors and hospitals, and we shouldn't, and it's not right. Vote yes for this amendment so we do not hold them under our thumb and say, you will take this or you will be fined. $2.3 million over 90 days. I don't think Delta Hospital can handle that. I don't think Haxton can handle that. How many people in here have been to Haxton? I don't think Haxton can handle that. The Starkey Bombs, who run a lot of wheat outside Haxton, probably need a hospital close by. What if there isn't one? What if they got to go to North Platte or come all the way down to Sterling? Those are the realities when we talk about the geographic diversity of this state. If Haxton does not have a hospital to go to, where are they going to go? It's not right. It's not fair. Vote yes for this amendment.
Representative Catlin.
Thank you, Madam Chair. I'm up to ask for a yes vote on this amendment. You know, out in my country, and I'm just one guy, but being told you have to do something, my heels get awful heavy. And I think the people in my district's heels are going to get heavy. Because I don't think anybody should be forced to go broke. When I first got this job, I went home after the interim, got a phone call from one of my clinics, a lot like the story that was just told by the minority leader. 9 months. Because the state of Colorado had changed their payment methods and their payment computer program, all the things that go with it. And he hadn't been paid. He called me and said, in about 2 weeks, we're going to have to close. So we went to work and he got paid. But the question I've got today is, would it force some of these places, if they're threatened with $10,000 a day, up to $40,000 a day, wouldn't it make more sense for them to just close and say, no, we're not going to take them because we're not in business today? That's an option that people don't seem to think about when we get the whip and the spur out. That we'll threaten you with this, but there's always one other option, and that is we'll close. The biggest employer in my community and the biggest employer in Cortez could just wake up one morning and say, rather than pay the fine, we'll just close. Think about that. This is a yes vote, please.
Representative Ransom.
Thank you, Madam Chair. And while I don't believe that the intent of this bill is to cause hospitals to go out of business, that is actually what the end result could very easily be. I agree with the previous speaker that talked about the real possibility that these huge fines, and I understand why the fines are being imposed. Imposing large fines is a way to try to get the hospitals to comply with the directives of this bill. But when I look at the section that this amendment is talking about, and by the way, I'm definitely asking for an aye vote on the amendment, it's the Commissioner of Insurance may require the healthcare provider, and then it goes on to they can also require the hospitals to meet the requirements of this bill. And the hospitals, this is on page 18, shall fine the hospital up to $10,000 per day for the first 30 days that the hospital refuses to participate, and up to $40,000 per day for each day over 30 days that the hospital refuses to participate. That is a huge amount of fines to be imposed. When we talk about all the mandates that we've put on hospitals and on the healthcare industry, and then they have to meet our forced decrease of rates, and then we fine them even further if they aren't meeting those. And then back on page 17, that the doctors can be fined not to exceed $5,000 against any applicant, licensee, certificate holder, or registrant. Those are some really steep fines, folks. So I actually have a legal memorandum here. I'm happy to let anyone look at it if you want to stop by my desk. It's from CMS, and it speaks about the Medical Practice Act, and there is no basis in the MPA for either the division or the board to impose administrative fines against licensees. So when the strike below committee report that we're discussing possibly amending by L066 that's up on the board right now, it has administrative fines on the pages that are addressed on this amendment. Okay, so there's no basis in the MPA for either the division or the board to impose administrative fines against licensees. It is axiomatic that an administrative fine against a licensee by the state of Colorado for failure to adhere to a state-imposed requirement amounts to disciplinary action against the licensee. Not only is such a fine not authorized by the MPA, it violates the United States and Colorado constitutions by abridging the licensure of a qualified physician by imposing an administrative fine, impairing the conduct of the business of qualified licensed physician by forcing the physician to accept patients covered under a particular health benefit plan, and third, forcing a qualified licensed physician to participate in a carrier benefit plan after the physician has freely declined to do so. I don't know about you folks, but when I was first elected and the first day I was sworn in, I held up my right hand and I swore an oath to uphold the Constitution of the state of Colorado and the Constitution of the state and the Constitution of the United States of America. I hold those oaths seriously, and based on this legal opinion, if we do not pass this amendment, we would be in violation of the constitutions of both the state and the United States. And with that, I strongly ask for an aye vote for this amendment. It would bring us back, at least in this one area, it would actually help get us back within constitutional requirements for this new procedure that we are talking about in putting into the state of Colorado. I ask for an aye vote.
Any further discussion on this amendment? Representative Pico.
Thank you, Madam Chair. How expensive is healthcare going to be when it isn't available? We're hearing from an awful lot of doctors, physicians, and we're hearing from the hospitals that are on the thin edge of bankruptcy. They're not going to be able to survive this. The people who are most going to be hurt by this bill with mandatory provisions and exorbitant fines are the very people that we all care most about. This is not going to help anybody. It's going to put people out of business. It's going to restrict and destroy the healthcare system in this state. It isn't going to do what it's expected to do. And I ask for an aye vote.
Further discussion on this amendment? Seeing none, let's see who wants to go on this route. Those in favor say aye. Aye. Those opposed, no. No. Noes have it. The amendment is lost. To the committee report, Representative Roberts.
Thank you, Madam Chair. I have an amendment to offer. I move Amendment L086 and ask that it be displayed.
The amendment is properly before us. Please proceed.
Thank you, Madam Chair. This amendment is the result of working very closely with physicians and medical providers in our state, and we needed some clarification on the enforcement piece that we were just speaking about. So this was a request of the family physicians who are neutral on this bill. It clarifies that this enforcement only happens once a year, and it may happen. So I ask for an aye vote.
Discussion on this amendment. Minority Leader McKean.
Thank you so much. And just a clarification. So if I'm a physician and I tell one person in January the 1st, let's just say, or maybe the 2nd, because I'm not open on the 1st. On the 2nd, I say, I don't take that plan, and then continue not to take that plan for the entire rest of the year, what would my total fine be?
Representative Roberts.
Thank you, Madam Chair. One-time fine per year, $5,000. It could be up to $5,000 for an entire calendar year. And it's a may, not a shall.
Any further discussion on this amendment? Seeing none, the question before us is Amendment 86. All those in favor say aye. Aye. All those opposed, no. The ayes have it. The amendment is passed. To the committee report. Representative Minority Leader McKean.
Thank you so much, Madam Chair. We have had a talk about some of the concerns that we have, some of the markets where we think we may have a challenge, and I would move Amendment L103 and ask for it to be displayed. You still have your copy, but here's it.
The amendment is properly before us. Please proceed.
Thank you very much, Madam Chair. So this amendment takes care of what are called BARE counties, BARE markets, B-A-R-E, and this means that where there is not a health benefit plan available, and it takes care of allowing this to not have coverage everywhere in the BARE markets where we are concerned about it. What we want to make sure is that the commercial carriers can still do whatever they need to do. Physicians can still accept patients.
Representative Roberts.
Thank you, Madam Chair. This amendment would render the entirety of the bill meaningless. I'd ask for a no vote.
Any further discussion on this amendment? The question before us is Amendment L103, excuse me. All those in favor say aye. Aye. All those opposed, no. No. The noes have it. The amendment is lost. Representative, I keep saying representative. Minority Leader McKean.
Thank you so much, Madam Chair. And that last one scared me just a little bit, but it's okay because I can bear on. Madam Chair, I offer I move L102 and ask for it to be displayed.
The amendment is properly before us. Please proceed, Minority Leader McKean.
Thank you so much. And folks, I apologize for a rather technical amendment. Here we are a little bit after 10 o'clock at night. This is an important technicality, though, because we have heard medical inflation used, that the accounting for medical inflation will take care of it. But medical inflation is actually a function of the Consumer Price Index. This actually accounts for what's the real number. And what we are asking for is that actually the increase in medical costs is part of the medical cost trend. And that is very different. What it means is it takes into account all those things. And in fact, think about what it takes into account this last year. It takes into account all of the increases that were not just due to inflation, but due to changing circumstances. All of the new PPE, all of the new things that we take into that, including, think about this, new sick time work rules. We're about to have new family leave work rules. We're going to have all of those costs. We're going to have increases all across the board in unemployment insurance. We're going to have all of those things. Those go to medical cost trend. I urge an aye vote.
Representative Roberts.
Thank you, Madam Chair. Thank you, Mr. Minority Leader. This is an important point, and I just want to point out, as far as the stakeholding went, that the original version of the bill had regular inflation in it. But through our stakeholder negotiations, the hospitals, the health insurance plans, the providers
asked for medical inflation, and we agreed to do that. And that will limit the total amount of savings that will be realized by consumers, but we thought that was important to do. That's what the healthcare industry asked. We've already put it in the bill in the strike below. We think medical inflation, given that it was the request of the healthcare industry, is adequate, so respectfully ask for a no vote on this amendment.
Minority Leader McKean.
Thank you very much, and thank you very much, Representative Roberts. I do understand that, and really what I'm trying to get at in this particular amendment is that we don't leave gaps that we don't have to, and so the challenge is that if what we're really looking at is are there other indexes of inflation of where medical costs are going, I feel that we should actually put those in the bill to make sure that we are adequately taking care of costs that are not costs that can necessarily be reduced. I urge an aye vote.
Discussion on this amendment. Seeing none, the question before us is Amendment L102. All those in favor say aye. Aye. All those opposed, no. No. The noes have it. The amendment is lost. To the committee report. Representative Minority Leader McKean.
Thank you very much, Madam Chair. Madam Chair, I move Amendment L071 and ask for it to be displayed.
The amendment is properly displayed. Please proceed.
Thank you, Madam Chair. And I would like it to be on the record that Representative Caraveo was having such good success with her amendments that I handed her a few packets and suggested that maybe she just try those for me, but she thought she said no. So, folks, this amendment actually makes the plan year that we base this off of 2019. Why does that matter? 2019 was a rather important year. 2019 was actually a year we have actuarial data about what is possible for plans, but not just that, it was a year before we had the worst year ever. It was a year before COVID, it was a year before all of those things, and so all of those inflations, all of those increase in costs were not yet there. 2019 should be the plan year that we use to base this.
Representative Roberts.
Thank you, Madam Chair. We did go back and forth during the stakeholding a lot between 2019 and 2021, but with the other concessions that were made by the bill sponsors and the coalition we were working with, the healthcare community, the healthcare industry, the hospitals, the carriers didn't object to us staying at 2021, so this is part of the agreement we reached in the strike bill. I'd ask for a no vote.
Minority Leader McKean.
Thank you, Madam Chair. Could we split the difference? Could we try 2020? Just joking. I'm suggesting you vote for this amendment.
Representative Soper.
Merci, Madam Chair. I also rise in support of this amendment. It's a great amendment because to move us before the pandemic changes everything. Because the way hospitals behaved during the pandemic and certain cuts that they had to make, especially in rural Colorado, rural western Colorado made a lot of cuts during the pandemic. We had to change our behavior a lot. And that basing it as we're coming out of this is very troubling because we actually had to make some significant cuts just because we didn't have the revenue. The federal government actually did not come through with the advanced Medicare payments to many of our rural hospitals until incredibly late in 2020. The bigger hospitals in the metropolitan area seem to get their advanced Medicare payments right off the bat. It was also incredibly unfair because these larger healthcare facilities that were not public hospitals, meaning not special district hospitals, were able to invest that and also take the interest off of that from money market accounts. Special district hospitals would be prohibited from doing that. So what that meant that they had to do is, in addition to the additional costs of PPE and staffing and the wave from COVID patients, meant that their bottom line, they had to start making some critical cuts. So throughout 2020, many Western Slope hospitals actually had to make those cuts because unlike the the federal government, when you're trying to run a business like a hospital, you have to make those key cuts to balance the books. You can't just create debt and write off with it. So what it means is that your days of cash on hand are greatly reduced. And the purpose of having an amount of days of cash, they recommend 90 to 100 is essential, is that's really just to wind up operations if you're going to shutter the doors of your hospital. So basing it on 2019, when we had actual actuarial analysis, a regular year in the Colorado healthcare market, a regular year in hospital operations, a regular year for clinics and doctors and nurses in their operations only makes sense. Because coming out of the pandemic, hospitals have changed behavior. They are doing things differently because, quite frankly, we're not out of the pandemic. That's actually the other issue of going beyond 2020 into 2021, is many of these expenses are still in place. Our hospitals right now are trying to do things like retrofit hospital rooms to be negative pressure rooms. And it's actually a very small expense to be able to do that. Very small expense per room. But it adds up as you have more and more hospital rooms that you're trying to make negative pressure rooms. But it also only makes sense because the public expects that. And that's why 2019 makes sense to be able to have that as the baseline year. Here's the other reason why it makes sense to have that as the baseline year. Over the last 3 years, Colorado hospitals have taken significant steps to reduce the cost of delivering services. A good example would be St. Mary's in Grand Junction, due entirely to competition from Community Hospital, which is also in Grand Junction, between Community and St. Mary's being head-to-head as far as competition and competing for patients. They were able to lower, this is St. Mary's, the cost of radiology by 50%. That's because Community was able to offer it at a less of a price, knowing that they could take patients from one side to the other. So hospitals are both competitors and collaborators as well at the same time. And this has been going on not just in Grand Junction, but around the entire state, which is why Colorado has actually dropped from being like sixth most expensive in the nation down to the bottom third. And I don't have the exact number on me. Maybe someone can help me out with that. But that happened over the last 3 years. And it happened from competition and one other element, which is reinsurance. And those two elements are why the price of healthcare in Colorado has gone down quite a bit over these last 3 years. So to actually have the baseline be at the end of where this reduction was actually taking place is a very logical starting point, which is why this amendment is a great amendment. For the same reasons that I just explained, if the amendment were to say 2020 instead of 2019, I would actually be opposed to the amendment because 2020 was a very unique year in the fact that it was an unprecedented pandemic. And so if anyone is thinking to run an amendment that would say 2020, I think that would be a very dangerous amendment because our healthcare facilities, hospitals, had a lot of costs that were not normal, but they also had to make a lot of reductions based on the fact that they couldn't do certain things like elective surgeries for 2.5 months. So that's why I support 2019, but not 2020 in an amendment. I appreciate the amendment, and thank you to the amendment sponsor. I'm a yes vote.
Discussion on this amendment. Seeing none, the question before us is Amendment 71. Oh, a division has been called. The question is the adoption of Amendment 71. A division has been requested. We will wait for everyone to return. Stay tuned.
Who should be excused? What's that? She left again. Yeah.
The question is the adoption of Amendment L71. A division has been requested. All those in the chamber not entitled to vote, please be seated. All those in favor of Amendment 71, please stand and remain standing, or raise your hand and keep it raised until the count is taken. You may be seated. All those opposed, please stand and remain standing in one place until that count is taken. You may be seated. Amendment 73 is lost. Amendment 71. What did I say? 73? I'm sorry. A little bit late at night. Amendment 71. To the committee report, Representative Roberts.
Thank you, Madam Chair. I move Amendment L085 and ask that it be displayed.
I was kind of hoping I would.
To the amendment.
Thank you, Mr. Chair. This amendment is brought in the spirit of transparency and accountability. It gives carriers or healthcare providers the ability to appeal decisions by the commissioner to the district court. I'd ask for an aye vote.
Is there further discussion? Seeing none, the question before us is the passage of Amendment L85. All those in favor, please say aye. Aye. All opposed, no. The ayes have it and the amendment passes. Is there further discussion? Representative Ransom.
Thank you, Mr. Chair. As I mentioned a little while ago, I have 2 hospitals in my district, meaning that I have an awful lot of doctors and nurses and other types of medical practitioners that live in my district because they like to live close to their place of work. And I have been hearing a lot from doctors, nurses, other medical practitioners, hospital employees, and others that are very, very concerned and not happy about what they've seen in this bill and even in what we're looking at tonight with the committee report. And I have an email from one of the doctors that lives in my district, and just like the one I read a couple hours ago, it's very sad to hear that we are potentially chasing people that have lived in this state for many, many years. We're potentially chasing them away by some of the actions that we're considering this evening. So here's one email written by a doctor. I will not mention his name, but Representative Ransom, I am a physician, member of the Colorado Medical Society, and a constituent in your district. I'm asking you to oppose HB 1232. I am tired. The stress and loss of income due to the pandemic is taking its toll on me. Several of my partners have left medicine to pursue a different career. Our group is having difficulty recruiting new physicians to move to Colorado. We mostly obtain new physicians that are coming out of residency. They are leaving residency with large educational loan debts. The pay for physicians in Colorado is already low. The housing costs are high. We cannot entice new physicians to come to Colorado. They are going to places like Florida, Georgia, and Texas, where they can make more money and pay less for housing. They only come to Colorado for vacations. HB 21-1232 will only make our situation worse. The bill gives more power to health plans and forces physicians to accept take it or leave it contracts through mandatory participation. We should be working towards lowering health care costs and providing good care to everyone, but this bill is an excessive burden on health care workers. Please vote no on HB 21-1232. Thank you. And it's signed by a doctor that lives in Douglas County. So, folks, I just hope that you're paying attention to this. We might be looking at some grandiose ideas in this bill, but they are going to have real impacts on real people that really live in Colorado, many of whom want to stay in Colorado, but are clearly feeling like they can't. The other email that I want to read to you tonight is in a similar vein. Dear Representative Ransom, I'm a radiologist in Denver and one of your constituents. I'm writing to express my deep concern regarding HB 21-1232, Standardized Health Benefit Plan, Colorado option. Expanding access to affordable care is a critically important issue that affects all of us. I have personally been encountering increasingly frequent incidents of the financial toxicity of the cost of health care adversely affecting patients' outcomes. However, as written, I fear HB 21-1232 will decrease access to care in Colorado and result in worse outcomes for our patients. Our fellow healthcare providers are still reeling from the impact of the COVID pandemic, and this bill will do more to shift power and resources away from providers in the community and into the hands of highly profitable healthcare plans. Reimbursement rates in Colorado have historically been less competitive with other areas of the country, and we are already struggling to recruit talented new doctors to join us. The provisions of the bill will certainly drive high-quality physicians and providers to retire early or move away from Colorado and make it more difficult to recruit new practitioners to come serve our communities. We need legislation that will increase access to affordable care, incentivize high-value healthcare practices, and help keep and attract the best providers to serve our growing communities. This bill will hinder these efforts rather than help. Thank you for your time and consideration, sincerely, and it is signed by a radiologist, a doctor that lives in Douglas County. Once again, folks, we here work under the Gold Dome. We are not out in the industry. I think we need to listen to the folks that actually work in the industry. I understand that there has been stakeholding on this bill, and I respect the stakeholding that has taken place and the people that did take part in it. But clearly, there are folks that were either not included or for some reason their voices were not heard. And the fact that I'm getting this type of feedback from doctors that live in my district should be telling to us. These are hospitals that are within driving distance of the metro area. I live in and represent Douglas County. These, the doctors, one of them, of course, is a Denver, has a practice in Denver, but he lives in my county. We really need to be listening to these doctors, folks. The idea of them leaving our state because of actions we are looking at this evening should have a chilling effect on all of us. I urge a no vote on this committee report.
Representative Carver.
Thank you, Mr. Chair. Again, I received scores, many emails from doctors of different specialties in my district in the last 2 days, and I am just reading a very few. Dear Rep. Carver, mandatory participation in a program with externally fixed rates does not allow doctors to run a business and adapt to increasing rent, increasing employee wages, and all the uncertainties of operating a clinic going into the future. Myself and many of my colleagues in ophthalmology are already struggling to make ends meet with draconian cuts in cataract surgery reimbursement by CMS over the years, on top of trying to catch up after having to close our doors for over a month and slow down our clinic for several months last year due to COVID. I also want to point out that doctors are only a small part of overall health care costs. As my late classmate, Senator Tom Coburn, used to point out, we need to seriously look at the cost of pharmaceuticals, which in my opinion is the most out-of-control component driving up health care costs. I will be very dismayed if this bill passes, referring to House Bill 1232. And I can assure you that over time, it will result in an exodus of the better health care providers from Colorado. The less competent doctors may remain, having less opportunity elsewhere. I myself have an active Arkansas license, a standing job offer in Arkansas for more money than I make here, and a daughter living there. I can retire or leave Colorado at any time, but I do not want to have to do so. It is so beautiful here. Please vote against this destructive proposal. The second email I'll read is also from an ophthalmologist serving Southern Colorado. And he writes, I have a practice of 5 MDs and 5 ODs and employ 60 individuals. I am a member of the Colorado Society of Eye Physicians as well as several other professional societies. I am writing to give my honest opinion to oppose House Bill 1232. We are proud to be serving a dozen counties, many of which are underserved and have limited access to care. In fact, I spent hundreds of hours per year driving to these destinations to provide eye care. To keep it simple, I staunchly believe that this bill is misguided and unethical. It will severely impact our practice by limiting the quality and quantity of care we can provide. Our profession has suffered major cuts in reimbursement, and also we have been disproportionately affected by the pandemic. The bill will ultimately hurt our state and its constituents. Please consider our opinions and oppose this bill. I ask for a no vote on the committee report.
Is there further discussion? Representative McKean, Mr. Minority Leader.
Thank you so much, Mr. Chair. I appreciate that. Folks, I get a little wonky about this stuff, and so I have been a little tough on where we get our data. So I offer Amendment L078 and ask for it to be displayed. Mr. Redding?
The amendment is properly before us. Please proceed.
Thank you very much, Mr. Chair. Folks, this amendment would require that there be an actuarial analysis, that we actually say you don't set these rates until you have an analysis, and that analysis is the basis upon which you do that. I urge an aye vote.
Is there further discussion on Amendment L78? Seeing none, the question, Representative Williams.
No, sorry.
Representative Ransom.
Thank you, Mr. Chair. I would like to speak in favor of L078. Folks, an actuarial analysis would be so much more valuable as these rates are being determined. We have set some pretty arbitrary numbers as far as the 18% decrease. Having an actuarial analysis would give us some real numbers to work with. It would actually do the actuarial analysis. It would allow people that understand how to really crunch these numbers. And you know that for my work across the street, I actually love crunching numbers. I think it's crucial to everything we do, actually, but especially when we are making changes of any kind. So getting this analysis would be valuable, and I thank the sponsor for bringing this amendment, and I urge an aye vote.
Representative Soper.
Thank you, Mr. Chair. So I also rise in support of this amendment. During committee, one of the expert witnesses for the proponents of the bill testified about how unaffordable Colorado's health premiums are. And one question that I asked was, what is the target affordable premium for certain family sizes per month? And the response I got back was, that was an impossible question to answer. And we had this brief exchange back and forth about, well, if it's impossible to know what your target premium is to be affordable, then how do we know what even affordable is? And if we are debating about what's affordable and it's going to be on a per person basis, I can tell you that actually paying anything, in my mind, might not even be affordable, because it's certainly nice to get something for nothing. But there's still a cost to this product and this service that you're getting. And that would be, as a covered live, you have insurance for in case things go wrong. And so to be able to have an actuarial analysis, to actually see what an appropriate premium reduction actually would be, makes sense. What we know is that the numbers that are currently involved in this bill, we couldn't find where the basis for those numbers were. We asked different witnesses who were testifying over and over again, what are these numbers based on? Show us the actuarial study that they're based on. Actually, just show us any study from Colorado that they're based on. We never, ever, ever saw any report, economic study, actuarial analysis to actually say what a reasonable premium reduction would be. Which is why it makes sense to have a study to find actual numbers, real numbers, not numbers pulled out of a hat. I mean, you could say go big or go home. I mean, we might as well make it, instead of an 18% reduction over 3 years, I mean, make it far larger. But all of us, I think, can agree that when making decisions, we should actually base it on real evidence. And that's why I like this amendment, and I'm in full support of it. Thank you.
Representative Baisley.
Thank you, Mr. Chairman. So yeah, I'd like to talk in support of this. I had a piece of paper handed to me this morning that I just had sitting on my desk, and I didn't know that it was relevant to the conversation so much until just now when this amendment was proposed, because it talks to actuaries, but also this comes from people that it would actually, this bill would affect in an enormous way, and that is one of the healthcare insurance providers, and that's Anthem. So Anthem's assessment reads like this, and it's just a single page. It says Anthem provides coverage in every corner of the state and is the only insurance company offering individual coverage statewide. As such, we look at the public option bill, House Bill 1232, through a framework of commitment to serving Colorado. Does the math work in the public option bill, 1232? No. Anthem actuaries use the provider reimbursements in the current bill to assess if these rates would result in insurance premium reductions for Anthem members. And the answer is most often no. The numbers do not add up. Anthem's actuarial analysis shows that if the public option were to pass with the current provider reimbursement formulas, the resulting premiums would mean that members in 1/3 of the 9 Colorado regions would not see premiums reduced by the required 6% in year 1. In year 2, members in 2/3 of the regions served by Anthem would not see rate reductions of the required 12%. And in fact, in some areas, we are concerned that premiums might increase for existing plans because Anthem has already negotiated a lower reimbursement level with providers. So will premiums come down under House Bill 1232? No. Only 3 regions would see premiums come down enough to meet the requirements in the public option legislation given the current construct of the bill. Additionally, one region would see a 0% premium rate reduction. And that means regardless of the insurance premium reduction percentage required in the legislation, premiums would not decrease because of the provider reimbursements delineated in the bill. The math just doesn't work. So over the past several years, Anthem has introduced health insurance plans that have reduced premiums by 15 to 25%. So requiring an additional 18% reduction for a total of nearly 45% would necessitate cutting providers or services, which in most cases is not permitted by law, and certainly not in the providers' or our members' best interests. So in sum, the public option just doesn't add up. All that to say, this from an insurance company's vantage, so I think that this amendment is wise in that we'd like to see what the actuary looks like before moving forward. Thank you, Mr. Chairman.
Representative Roberts.
Thank you, Mr. Chair. I appreciate this amendment. I actually agree with you that the rate should be actuarially sound. That's why it's already in the bill. Page 4, line 18. The rates must be actuarially sound and allow a carrier to continue to meet the financial requirements in Article 3 of this Title 10. This is redundant. I ask for a no vote.
Representative Ransom.
Thank you, Mr. Chair. And I'd actually love some clarification on that from the sponsor. The rates being actuarially sound may or may not equate to doing an actuarial study. And I guess that's what I would love to have clarified.
Representative Roberts.
Thank you, Madam Chair, or Mr. Chair. Representative Ransom, by putting this in statute, that means it's statutorily required that the commissioner or the Division of Insurance do an actuarial analysis to ensure that it's actuarially sound. If they didn't do that, they would be running afoul of the statute.
Representative Ransom.
And I appreciate that. Thank you very much for answering the question. I hope that we have money in the bill to cover the cost of that study, because it truly should be done by an outside entity or by clearly somebody that is qualified to do it. And the reason that I also wanted to ask that is I have one line here. This is from another doctor that contacted me, and he was very concerned about the economic impact. And this one sentence in his email said that there was a report by the think tank Common Sense Institute found that House Bill 1232 could result in up to $1 billion less in payments to doctors, nurses, hospitals, and other healthcare providers. The report estimated that 3,900 to 4,900 healthcare jobs could be lost. So again, I think the actuarial study would be very important. Whether or not these numbers are provable or accurate, the actuarial backup would be very helpful. So again, I see the sponsor coming up, so I'll step away. Thank you, Mr. Chair.
Representative Roberts.
Thank you, Mr. Chair. Thank you, Representative Ransom. J001, which was approved by the Appropriations Committee a few days ago, appropriates $400,000 each year for an actuarial analysis done by a third party.
Is there further discussion? Seeing none, the question before us is the passage of Amendment L78. All those in favor, please say aye. Aye. All opposed, no?
No.
The noes have it and the amendment fails. Representative Roberts.
Thank you, Mr. Chair. I move Amendment L089.
Thank you. To the amendment.
Thank you, Mr. Chair. I have a few amendments here, members, that reflect stakeholding work as well as working with our drafter to clean up some technical things. This is one of those technical amendments. This is something that the drafter requested to make clear that the prohibition on balance billing applies only to this plan and not other plans in the commercial market. I'd ask for an aye vote.
Is there further discussion? Seeing none, the question before us is the passage of Amendment L89. All those in favor, please say aye.
Aye.
All opposed, no? The ayes have it. The amendment passes. Representative Roberts.
Thank you, Mr. Chair. I move Amendment L090.
I don't wonder what. To the amendment.
Thank you, Mr. Chair. This one is very technical. This just aligns the strike below with existing statute. I'd ask for an aye vote.
Is there further discussion? Seeing none, the question before us is the passage of Amendment L90. All those in favor, please say aye.
Aye.
All opposed, no? The ayes have it. The amendment passes. Representative Roberts.
Thank you, Mr. Chair. I move Amendment L093. Yeah, maybe after this one.
To the amendment.
For this one. Thank you, Mr. Chair. So this one, the L093 reflects a lot of work that we've done with stakeholders, particularly lower cost, lower margin providers who asked, and insurance carriers, and these discussions have been going on for months and weeks, but also during the course of today, and this is something we agreed on with the industry today. What this amendment will do will ensure that there is not an unfair competitive advantage for new carriers that enter new parts of the state, and making sure that we're honoring the investment that carriers have already put into some of these counties, particularly the lower competition counties. This is something they asked for. We think it's the right thing to do, so I'd ask for an aye vote.
Is there further discussion? Seeing none, the question before us is the passage of Amendment L93. All those in favor, please say aye. Aye. All opposed, no? No. The ayes have it. The amendment passes. Representative Van Winkle.
Hey, Mr. Chair, I think that was like 4 in a row, so let's make it 5. I move L107.
To the amendment.
Thank you, Mr. Chair. And what I'm worried about in this bill is that it will reduce the number of options available for the people of Colorado to find insurance. And it'll reduce options so much, in fact, that, right now you can choose between Kaiser, United Healthcare, Blue Cross Blue Shield, all these different options. I'm worried about that going away, and so I've drafted this amendment to ensure that, as a whole, if 50% of health plans in Colorado disappear, and like United Healthcare, Blue Cross Blue Shield, if they all get up and say, you know what, we can't work in Colorado anymore, we're gone. If 50% of them leave, then this section no longer applies.
Representative Williams.
Thank you, Mr. Chair. And, I was happy to co-sponsor this amendment with Representative Van Winkle. I think it makes a lot of sense. If the premise of the policy that we're debating right now is that we want to increase access to health care and lower costs, then I think this is a great amendment that will help ensure that happens. And if the policy fails, if we go in the opposite direction, then this is something that we want to put in place, because if the policy ultimately is not working, then we should not keep it indefinitely. And I think this puts a good measurement on it and ultimately a piece of accountability within the policy itself. So please vote yes.
Is there further discussion on the amendment? Representative Holtorf.
Thank you, Mr. Chair. The middle part of that amendment I thought had great merit because it aligned with the traditions of the SMART Act hearings that we do in January. But the bill sponsor did point out that he already has it in the bill under a different paragraph. So I just wanted to point out how important it is that these particular entities do have a reporting requirement to the General Assembly. And I think that's important to retain that tradition. Thank you.
Is there further discussion? Representative Luck.
Thank you, Mr. Chair. As someone who has lived in societies where there was only one option for health care and was unable actually to access health care, I think this is an important amendment, because if we see people leaving the market and those choices are reduced, then we will find new problems being created. And so we should have a mechanism in place to monitor how many of the different providers are still in the market, and if they reduce to a certain level, be able to adjust course and find a new policy. Thank you.
Representative Ransom.
Thank you, Mr. Chair, and I speak in favor of this amendment too. Our bosses, the people of Colorado, several years ago made it very, very clear in an election on Colorado Care that they did not want a single-payer system in our state. The vote was almost 80%. It was 79, 78 point something. So close to 80% of Coloradans did not want a single-payer system. This amendment would prevent that from happening. If this bill does then result in, as the emails that I read a few minutes ago talked about, some doctors that were literally thinking they would have to leave the state. If this policy takes place and kicks into gear, then if we drop down to 50%, then it would prevent us from actually falling into the position where we would be forced into a single payer or some type of government-only system. because again, the voters of Colorado made it ultimately clear that they did not want that as the healthcare system in our state. So I urge an aye vote on the amendment, and I thank the sponsors for bringing it.
Is there further discussion on this amendment? Seeing none, the question before us is the passage of Amendment L107. All those in favor, please say aye. Aye. All opposed, no. No. The noes have it. The amendment fails. Representative Van Winkle.
Thank you, Mr. Chair, and that very much disappoints me. So I now move L108. Thank you to our chief clerk and the front desk staff. They're fantastic.
The amendment is properly before us. Please proceed.
Thank you, Mr. Chair. And what this says is if 10% of hospitals in Colorado close due to this bill, then essentially the bill is repealed. And just in case you're wondering, that would be 12 major hospitals. These are general hospitals that offer lifelines to their communities, and if 12 of them across the state of Colorado were to close as a result of this bill, then the bill would be repealed, and hopefully those communities could come back to life. These hospitals truly are lifelines to their communities. In many parts of Colorado, if a hospital were to close, it would mean not just hours driving, but hours and hours and hours and hours of drive, especially in the rural parts of Colorado. So I ask for a yes vote on this amendment by myself and Representative Williams.
Representative Williams.
Thank you, Mr. Chair. And this is very similar to the prior amendment that we had offered. Again, Representative Van Winkle had pretty much touched on it. 10% of fewer hospitals in any given plan year after the policy is passed would essentially, again, repeal this policy. If the goal is to increase access, if the goal is to decrease costs, if the goal is to provide better healthcare outcomes for Coloradans, but it ends up having the opposite effect, then we should probably scrap the bad policy. And the way we can measure this and account for it is in the amendment here with respect to having a report that's prepared and submitted to the legislature so that we could ascertain whether or not these hospitals have closed. And if they do close, then I will submit to you that's bad policy, that's going to lead to ration care, that's going to lead to worse healthcare outcomes for patients, and it will certainly drive away healthcare providers. That is not something that we want, and this is another good accountability measure that we can place in this, just so that we're making sure that good policy is indeed passed in Colorado. So please vote yes.
Representative Soper.
Thank you, Mr. Chair, and I also rise in support of this amendment. And you left the podium. Yeah, all but it's a good amendment. Thank you. Because in the given plan year, if there was a 10% reduction in hospitals, that would mean that patients' access to care would be denied. And at that point in time, we're entering a bit of a free fall as a state when it comes to patient access. And this should be all about patient access, because already we're frustrating one side of things by having hospitals reduce their costs. But then if it's so burdensome that it results in up to 12 hospitals or 10% actually shuttering their doors, mothballing the works, then we should be able to step back and say, maybe that wasn't such a good idea. We heard testimony in committee that 53% of Colorado's hospitals are operating at a level that is not sustainable economically. 53% of Colorado's hospitals are not making ends meet. This only covers 10% of our hospitals for the trigger element, but 53% of our hospitals are currently teetering on the edge. And to say that they had less money in their operations is just enough to push it over. Now, I know when we're talking about hospitals, people think these monstrosities, fancy European cars in the parking lot owned by the doctors. But hospitals are the access to care. They provide the treatment for everyday Coloradans like you and I. Every single day, these doctors in these hospitals provide life-saving care. They give people quality of life. As a matter of fact, Colorado's hospitals provide some of the best care in the entire United States, and in the United States, we arguably have the best healthcare system in the entire world. But to have the best also costs a little bit of money as well. And if it gets to a point where these 53% of our hospitals, a little over half of our hospitals, if a few of them are unable to find a way to make ends meet as they're being told you need to reduce even more, then they're left with no other choice than having to cut access to Coloradans. Access may not come in terms of an entire building, but it could be certain practices as well. And it could be not having certain providers, especially in rural Colorado. It could be that instead of being able to see your doctor tomorrow or next week, which is relatively quick, that you're having to wait 6 months or a year just to be able to get in to see your doctor. And if we're getting to that point in time, it's altogether likely some of these hospitals will close their doors. Now, it won't be a straightforward closing. I guarantee you many of them will look to mergers and acquisitions, so to be acquired by a larger hospital chain if you're an individual hospital. Because that's what hospitals will do. They'll find every way to stay afloat. And the logical next step, if you can't make ends meet, will be to join a larger hospital system. Like merger and acquisition law, and just policy from the business side of things, if you're acquiring a hospital as a larger chain, the first thing you're going to do is say, I want to find efficiencies in the system. So if a place like Delta gets acquired by, say, an SCL Health, well, it's altogether likely that they'll say, you know what, we'll close Delta because it's only an hour drive from Delta to Grand Junction. Never mind that you may have to go rushing in with a broken arm or a heart attack or a stroke. An hour is too far. But that's just from Delta. What if you had to go from Paonia? Hour and 45 minutes to get to that. That's the result of consolidation. Corporate execs far away from the location where they have negotiated this merger and acquisition, they don't care. They're just looking at it as a business transaction. But that results in fewer hospitals in Colorado, and it results in denied access to care for Coloradans. That's why this is a good amendment, and I appreciate the amendment sponsors and would ask for a yes vote. Thank you.
Representative Baisley.
Thank you, Mr. Chairman. You know, there are only 5 states whose medical costs are lower than ours, which is pretty impressive. With all the good quality that we have, only 5 are lower than Colorado. But yet we're going to put the squeeze on them even more than we already have through this bill. So the fear has been brought up over and over and over, the concern, I should say, the concern that we will lose access because of the 3 legs of the stool, cost, quality, and access. One of those has to give way. Access is what's going to give way. So we will lose hospitals. That's what everyone's concerned about. So this bill is pretty simple. It just says if we start losing hospitals, then because they're closing because they cannot survive this policy, then let's back off the policy. The only reason I can imagine voting against this amendment is because we're in fear of that happening, and we don't want the consequence of backing off the policy regardless of the consequences. So let's not make that mistake. Let's please vote yes on this amendment. Have that as a plan B just in case, because that's the big fear, and this would alleviate that concern in a big way by giving us an out if we start losing hospitals. I strongly urge a yes vote on this amendment.
Is there further discussion? Did I hear you call for a division? Okay, a division has been requested. The question before us is the passage of Amendment L108. A division has been requested. All those in the chamber not entitled to vote, please be seated. All those in favor of Amendment L108, please stand or raise your hand and remain standing, or keep your hand raised until the count is taken. You may be seated. All those opposed, please stand and remain standing, or raise your hand and keep it raised until the count is taken. You may be seated. Amendment L108 fails. And the committee will stand in a brief recess. The committee will come back to order. Majority Leader Escar.
Thank you, Mr. Chair. I move the committee rise, report progress, and beg leave to sit again at Friday, May 7th at 12:10. 12:10.
Seeing no objection, the committee will rise, report, and ask leave to sit again at 12:05 a.m. on Friday, May 7th.
The House will come back to order. Mr. Gregorio, please read the report.
Mr. Speaker, your Committee of the Whole reports it as follows. It has risen reports progress and begs leave to sit again at May 7th at 12:10 a.m.
I said 12:10 on accident. He said 12:05, so just do 12:05. 12:05, is that enough time for you guys? 12:05. The problem is I said 12:10, Kennedy said 12:05.
The committee will sit again on Friday, May 7th at 12:05. We will continue to do a few business items. Mr. Gregorio, please read the reports of committees of reference.
Committee on Business Affairs and Labor. After consideration of the merits, the committee recommends the following: House Bill 1288 be amended as follows and be so amended be referred to the Committee on Finance with favorable recommendation. House Bill 1290 be amended as follows and be so amended be referred to the Committee on Appropriations with favorable recommendation. House Bill 1293 be referred to the Committee of the Whole with favorable recommendation. Committee on Education. After consideration on the merits, the committee recommends the following: House Bill 1294 be amended as follows and be so amended be referred to the Committee on Appropriations with favorable recommendation. Senate Bill 151 be amended as follows and be so amended be referred to the Committee on Appropriations with favorable recommendation. Senate Bill 191 be referred to the Committee of the Whole with favorable recommendation. Committee on Energy and Environment. After consideration on the merits, the committee recommends the following: Senate Bill 166 be referred favorably to the Committee on Appropriations. Committee on Finance. After consideration on the merits, the committee recommends the following: House Bill 1159 be postponed indefinitely. Committee on Health and Insurance. After consideration on the merits, the committee recommends the following: House Bill 1068 be amended as follows and be so amended be referred to the Committee on Appropriations with favorable recommendation. House Bill 1276 be amended as follows and be so amended be referred to the Committee on Appropriations with favorable recommendation. Senate Bill 142 be referred To the Committee of the Whole with favorable recommendation. Committee on Judiciary. After consideration on the merits, the committee recommends following House Bill 1280 be amended as follows and be so amended. Be referred to the Committee on Appropriations with favorable recommendation. House Bill 1298 be referred to the Committee of the Whole with favorable recommendation. Committee on State, Civic, Military, and Veterans Affairs. After consideration on the merits, the committee recommends following House Bill 1277 be referred to the Committee of the Whole with favorable recommendation. House Bill 1287 be amended as follows and be so amended. Be referred to the Committee of the Whole with favorable recommendation. Senate Bill 132 be postponed indefinitely. Committee on Transportation and Local Government. After consideration on the merits, the committee recommends following House Bill 1284 be referred to the Committee of the Whole with favorable recommendation. House Bill 1291 be amended as follows and be so amended. Be referred to the Committee of the Whole with favorable recommendation.
Printing report.
The chief clerk reports.
Printing report will be printed in the journal. Sign of bills, resolutions, and memorials.
The Speaker
Sign
has
of
signed.
bills, resolutions, and memorials will be printed in the journal. Message from the Senate.
Mr. Speaker,
Message from the Senate will be buried in the journal. Hold on one sec, Madam Majority Leader. Madam Majority Leader.
Thank you, Mr. Speaker. I move to lay over the balance of the calendar until Friday, May 7th at 12:05 a.m.
Seeing no objection, the balance of the calendar will be laid over until Friday, May 7th at 12:05. Majority Leader Eskar.
Thank you, Mr. Speaker. I move that the House stand in adjournment until Friday, May 7th at 12:05 a.m.
Seeing no objection, the House will stand in adjournment until Friday, May 7th at 12:05 a.m.